Begin.
Half a day. Welcome, everyone. The Committee on Health, Tourism, Historic Preservation, Land and Justice is now called to order. It's Wednesday, September 16th, 2020, and it's 2:06 p.m. Notices for this roundtable discussion were disseminated via email to all senators and all main media broadcasting outlets on Thursday, September 10 and Monday, September 14th, 2020. The notice was also published in the Guam Daily Post on Wednesday, September 9 and Monday, September 14. There are general rules of conduct for this Zoom meeting, and it will be hosted by the legislature's MIS and AV staff. And thank you for your assistance to all the staff. And the host of this hearing will mute all Zoom participants until called upon by the chair. Members of the committee and or the legislature wishing to speak may indicate their desire to the chair, and we will take turns. Individuals testifying shall first be recognized before speaking, and please state your name for the record-keeping purposes. The order of questioning will, of course, begin with the chair and with the senators, and we might go for a couple rounds if necessary. Questions and testimony shall be confined to the substance or nature of the agenda. The personal inference as to the character or motive of any senator or any individual testifying is not permitted. Any violations of this general rule of conduct will result in removal from the public hearing by the host. So today's roundtable will convene for a discussion with the University of Guam School of Health, the Guam Community College, the Guam Marianas Training Center, the Guam Board of Nursing Examiners, the Guam Nurse Association, the Guam Department of Labor, Guam Economic Development Authority, on building nurse capacity on Guam. So the overall goal of our discussion today is to, of course, get a clear picture where we are with our current capacity and our ability to grow locally the nurse workforce, nurse and related fields, and to sustain this workforce. And I don't think I have to tell anyone here how critical it is. And that you've all been the ones working very hard to grow this field on Guam. So we have representatives from these entities that I named earlier, and I've asked them to give a very short presentation as to information on their educational programs that are currently available and any efforts or barriers, and especially any impediments to the expansion of their programs. If there's any financial aid available, we want that to be made known to the public that's watching. And what are the challenges in training or certifying or graduating Guam residents as nurses, nurse assistants, or those related fields. And so we have quite a panel today. I'm very honored. Thank you all for accepting the invitation. The Guam representatives from the Guam Board of Nurse Examiners and the Guam Nurse Association have also been invited to share the measures that they've taken to ensure that our island is equipped with long-term quality nurse workforce, and the challenges that those entities face. One is a licensing entity and one is a nurse association, advocacy and organization for nurses. And we want to know the challenges that they're facing with training or certifying or just from what they hear in their fields, from what the challenges are to maintain this capacity. And how they have acted to assist the training institutions in overcoming challenges to expanding the local training program. We've also invited the Guam Economic Development Authority to discuss GIDA's role, of course, in the expansion of nursing capacity and infrastructure on Guam, and specifically the various economic resources and grant programs available for this purpose. And we've invited the Guam Department of Labor, who is also has several programs, especially their manpower development programs, their apprenticeship programs that have assisted in growing this capacity on Guam. So I want to acknowledge, of course, my colleagues who are here with us today, beginning with our Legislative Secretary, Amanda Shelton, Senator Shelton, with the Assistant Majority Leader, Senator Kelly Marsh Taitano, the Minority Leader, Senator Tello Taitigui, Senator Mary Camacho Torres, Senator James Moylan. Thank you all for being here. We also have with us from the University of Guam, President Thomas Kreis. Thank you, President Kreis. Dr. Margaret Hattori Hachima, Dean of the UOG School of Health. Dr. Catherine Wood, Associate Professor of the School of Health. And we have from the Guam Community College, President Mary Okada, the Vice President Virginia Tudela, the GCC Administrator Dee Duenas, the President and CEO from the Marianas Training Center, Faye Valencia Ovales, welcome. And from the Guam Board of Nurse Examiners, and this is the licensing board for the nurse practice of nursing on Guam. We have the chairperson, Bernadette Santos, MPA BSN RN. We have Dr. Kevin Hitosis, the co-chair. And we have Xenia Piscina, the Guam Board of Nurse Examiners Executive Director, and she's also the Health Licensing Office Administrator for the Department of Public Health and Social Services. From the Guam Nurse Association, we have Rose Greeno, President, thank you. Suzanne Lobaton, the Vice President. Glynis Almonte, the Executive Director of the Guam Nurse Association. We have from the Guam Economic Development Authority, Melanie Mendiola, the CEO. Thank you for joining us. And we have from the Guam Department of Labor, the Apprenticeship Program Coordinator, Ms. Phyllis Tapasna. Thank you very much for joining us today. Yes. All right. Okay, so since I've pretty much told everyone what we were going to talk about today, I'm just going to hand them the floor and let them give a brief presentation, and then we can ask questions after that if not. So we will begin with the University of Guam School of Health, or the University of Guam. And then we will hear from GCC and then the Marianas Training Center. So the training centers first, the training schools first. All right, and so prior to the roundtable, I had requested the University of Guam to discuss UOG's role in the expansion of nursing capacity and infrastructure, UOG's nursing and caregiver programs, the average size of cohorts, barriers to expansion, availability of financial aid in these areas, and to share any challenges they may be facing with training and certifying Guam residents as nurses or nurse assistants. And before I go any further, this hearing concentrates on building local capacity. And of course, we have a need to also recruit from off-island, especially specialty nurses, and just to recruit because we are not able to meet the need locally. But we are trying to meet the need locally, and that's what I really want to concentrate on today. And on September 30, we will be having a hearing on a bill to assist in the expansion of recruitment of off-island nurses. But for today, we're trying to concentrate on growing this local capacity. So we will begin with UOG. And so President Kreis, Dr. Hattori Hachima, and Dr. Wood, thank you again for being with us today, and you may proceed.
Thank you, Madam Chair. Thank you, honorable senators. Delighted to be here for this important conversation. Dr. Hattori Hachima will lead the presentation, but I just wanted to emphasize the really high quality of the School of Health and our nursing program with 100% pass rates for multiple years in a row, our 100% placement rate this year, and a high percentage, and you'll see specifics on all of this. And thank you, Madam Chair, for your reference to the recruitment from off-island. I think it's important to pay attention to how much money is leaving Guam to pay for travel nurses. And so if we can build our own capacity, that becomes, that 7 million or whatever we're spending on that, becomes available for the development of our own capacity people here, very superbly well trained. We can do that here, and it's money, but we have to have the base of support. We need to pay for the biology classes, the chemistry classes, the English classes, and then all of the nursing program, right? We have an entire infrastructure to maintain there. So I think that's really important to be aware of the need for the basic sort of funding. And then we also have to pay attention to the student financial aid. So that's another thing. So both the basic funding for the university and the student financial aid have been in a steep decline for at least 4 years. And this is getting to be really serious for us. So you're going to see with the School of Nursing a story of extraordinary achievement, but this is achievement that's been based on the support that happened up until about 4 years ago, and then it's been in pretty steep decline. And so we're getting to a point where it's pretty critical. And so I think Dr. Margaret will be able to point out some of those. And besides the education and then the training, I think it's important to point out the way our School of Health has been engaging in serious high-level research, as well as getting off-island federal grants to support geriatrics and also cancer treatment and so on. So there's a lot going on here, and I think it's just good to pay attention to all of these pieces. So I really do appreciate everyone's attention to all of this, and I'll turn it over to Dr. Margaret.
Okay, thank you,
Mr. President.
Thanks, Senator. And I'm going to share, she's up, your staff is uploading the presentation, but I'm going to go ahead and share the presentation. That way, Senator, I won't ramble and I'll be focused. Okay, it's still showing disabled screen sharing. Okay, thank you. I got it. Okay, thank you very much, Senator. And I'll try not to take too long because we do have a lot to cover. And I know the focus is on the workforce. But as the president said, I just wanted to bring up a couple of other things that have been going on with the school, including the COVID response. So I just wanted to show you our school health organizational chart, because although many people refer to it as just a nursing program, it's important to note that we do have a health science program, particularly now in light of the pandemic. Our health science students and graduates, as well as our social work graduates, have been helping public health. And public health recently, a couple months ago, hired about 15 of the graduates to assist with contact tracing and case investigation. So I just wanted to point that out. And we also have other grant programs that I'll mention in a little bit. But so I just wanted to show you that, that in terms of funding and employment and faculty and staff, it's not just the nursing program. However, I know the focus today is on nursing. Okay, and so with nursing, we only have, you're right, I mean, we've had conversations before about our staffing limitations. And in the past few years, we were actually able to recruit because UOG has designated nursing faculty as hard to hire. Prior to being designated hard to hire, the salaries were terrible. I couldn't recruit anybody because the pay, it was just horrible. You can get paid more anywhere, even within Gov Guam, as well as, of course, the private sector. So thankfully, when we were deemed hard to hire, it made it much easier. And then also Take Care has given us we've gotten the $100,000 a year qualifying certificate, which has enabled us to supplement some salaries. And I'll discuss that in a little bit, but we only have 7 full-time faculty, 2 are PhD, Dr. Wood, Dr. Mendez. However, Dr. Wood is going to retire in September, and the end of this month. I know she delayed it. She was going to retire in May, but because of COVID, I just really want to thank her because she stayed to really assist with the pandemic. And so without her, I know we couldn't have made it through the spring semester. And then we have 1 doctor of nursing practice, Anna Varghese. And then we have our 4 MSN faculty, Vicky Alave, Natalie Capaci, Jennifer Turner, and Rosalind Babauta. We have 7 part-time faculty, and the problem with the part-time faculty, okay, it's not a problem, but it is only a problem because of the pandemic. Most of them work at GMH, which is great because you want faculty that are current in their clinical practice to be the ones helping train our students at the bedside. And so these are great nurses. Most of them work at GMH. However, now because of the pandemic, that group of 7, may or may not be able to assist us depending on what PCOR status we're in and the status of GMH. But prior to this, our accrediting council really highlighted the fact that we have an excellent faculty and we have excellent part-time faculty. And they met our part-time faculty when they were here. And so I really want to stress that, this is very important. However, we're using our Take Care funding to supplement the salary because the salary that UOG pays alone for part-time faculty is not competitive. And so we were not able to recruit part-time faculty without Take Care's QC. And then we have 2 classified staff, and this has been a real huge problem for us. We have 1 AA and 1 PC3. Our PC was actually a PC2, and then we were able to get him get that adjusted to a PC3 through a desk audit. But it's taken us at least 2 years to try to get another position. And so the president has been very supportive and approved 1 more staff. So we're in the process now of we have an open position and our HRO has rated the staff. But it's important to note that without the staff, it's very difficult for me personally to juggle all the 3 programs and even to juggle, as you'll see, our addition of nursing assistant and caregiver. And because of the limitations with staff, we are actually turning down some things such as some grants, and I'll explain that in a second. But our student enrollment, this is what you're more interested in. In spring, when COVID hit, we had 26 seniors. They did graduate early to assist with the COVID-19 pandemic. And fortunately, because it was mid-March, they were almost completely done with their practicum. And these were really highly trained students because they had already been at GMH, for the past 2.5 years. And so they've gotten great training. They all graduated in April and a few graduated in May, but immediately, and thanks to Zena's here from HPLO, Zena actually worked with us as well as our Board of Regents. The faculty spent, several weeks drafting a plan to safely graduate them early and also maintain our accreditation guidelines. But she was able to give them all graduate nurse status immediately. And I've got to really applaud her because that was in April and we were very stressed. And right away, I was very happy that GMH hired 14 of them, 9 at GMH. 14 at GMH, 9, that should be GRMC, and 3 at HSP and Public Health. So I'm very proud of the hospitals. Both administrators, Lillian Posadas and Jennifer Cruz, really worked hard with us and with the board to get these people on board and hired very, very quickly. And so I've got to just say that it's not, I've complained to you before about GovGuam hiring and that it takes too long. GMH and GRMC hired within days. And so this was very important because in order for UOG to push the graduation, it means nothing if they're not going to get hired. And so we're very, very happy. We had 29 juniors and 44 sophomores. We did increase our admissions and admitted 9 more than the previous year. So prior to COVID, we were on track to really increase our cohorts. And in 2020, this semester, in August, we started with 29 seniors and 36 juniors. But we do have 49 in pre-nursing and 2 second step VSNs. I think they're both from the Micronesian region, and they have associate degrees in nursing. And so we are putting them in our program to get the bachelor's degree. And so, I'm not going to go over the numbers, but I just wanted to show you that, we have tried to make efforts. The bottom line shows our total cohorts that we admit. The top shows how many applications we receive because, people sometimes say we've got, like hundreds of students on a waiting list, which is not actually accurate. And so, we don't turn away that many students. We used to get higher numbers, maybe in the 60s. And so we were turning away more in the early 2000s, but now, people are, UOG has other programs such as our bio program has expanded to include almost a pre-med track. And so now we're seeing more students going into other degree programs. But we are consistently admitting LPNs from GCC's program primarily. And we're very happy because the GCC PNs do very well. And, they don't drop out because, they know they want to be a nurse. So we're very happy with that collaboration. And so our last cohort, like I said, was 44 sophomores, but we took 45, but one was called to active duty, so withdrew, but we are saving his slot, of course, and he can return when he completes his military service. But so the faculty have made an effort to increase. Of course, our pass rates, the president mentioned that we've actually had 4 years in a row of 100% pass rate for our May graduating cohorts. We're required to report annual because there's sometimes you get a graduate that will graduate in 1 year but not take the NCLEX until the next year. And so that's why you'll see in 2016, our pass rate was 94.7, and then our annual in 2019 was 96.8. However, we're well above the national, and this bottom shows your national pass rates for first take, and this is for baccalaureate degree students. And so, we got the 29 statistics at 91%, so we're doing well. And then just today, we found out that our 2020 graduates, 3 have already tested. Thanks very much to Xenia again. She's really facilitating that they find out their test results quickly. And so 3 tested and they all passed. So we're very, very happy. There are limited seats for them to test due to COVID because of the social distancing. And in fact, I think there are maybe less than 10 seats available between now and the end of the year. So that's very distressing for us, of course, because statistics show that if they take within the first 3 months, their likelihood of passing is much higher. We have used our Take Care funding to purchase for them what's considered one of the Cadillac products. It's the Kaplan NCLEX testing. And so each student has that. And the faculty have been working with them, mentoring them until the time they test. I'm not counting on 100%, but we're very hopeful that they'll do well. Our job placement rate, as you can see from this, it has really improved. We struggled prior to 2014. We struggled. You'll see it's low. We have to track when if they're employed within 6 to 9 months for accreditation. And so when GRMC opened in 2015, GMH also streamlined their hiring process. And so now our graduates are hired much faster than they used to be. And this is great. And so in 2019, 18, 19, 20 is very high. 2019, we had a few graduates that moved off island because of military, being a military dependent, and one tested late. And so 2019, 90% were hired within 9 months, but all were hired within a year. So as soon as they took their NCLEX, they're all hired. And so it's actually 100% employment. It's just that with iTrack, 6 to 9 month employment. And the vast majority of the graduates are staying on Guam. And in fact, the only ones leaving in the last 3 years are those that are military dependents. Our program completion, I know you're concerned about retention. The Accrediting Commission requires that we track from the moment they are admitted into the nursing major to the time that they graduate. And we did have a period in 2014 and 15 where our retention was very low, and we had anticipated that. There were a lot of reasons for that, but we submitted a plan to the Accrediting Commission, and those numbers have come up dramatically. Part of the issue is being able to provide adequate advisement. And of course, we are concerned with the pandemic that we may see this retention drop only because we're not face-to-face with the students anymore. And, we need to, it's just very difficult to make sure you get the students and advise them. It's harder for them to come and ask for help because, of course, they're not seeing us. It will require, that they text the faculty or they email the faculty or the staff. And, sometimes that's just an impersonal an impersonal means, and it's harder for the students. So we have great staff and faculty that are reaching out to the students, and anyone that we know is having difficulties with their grades, we give them letters of warning at midpoint and for every course, and then our staff and faculty follow up with the students. So we put a lot of emphasis on retention because, as you all know, we're cohorted. So if, for instance, if I admit 20 students and 10 drop out, I can't replace the 10. So no matter what, my number of graduates will drop because I can't admit students in midstream. So it's really distressing to us to lose students. And so we're really working on our retention. However, our current retention rates are in line with national average. I will say, though, our retention rates are higher when you compare us to schools with students that are first generation and have English as a second language. If you compare us to those schools, we're actually much higher. And we do have a lot of students where English is a second language. In terms of the SFAP, the financial aid, and I know you got this from Mark Duarte, our FAO director, but I just wanted to point this out for the other senators. These are the numbers of our students currently on the nurse training scholarship based on fiscal year. At this current moment in time, unfortunately, we only have 8 seniors that are on the scholarship. The juniors have not applied yet, and the application will hopefully open soon. I talked with Mark a few days ago and expressed my concern that we need to really get these applications out because students are waiting to find out if they're going to get the scholarship, and that creates some difficulties. And so, I think the nurse training scholarship is very important. It's a very successful program. We remember a few years ago we changed it, and the service payback is 2 years of service for every 1 year. And it had been 1-to-1. And I think at 1-to-1, that was just, a great value for students, but not necessarily a great value for Guam. And so really the faculty and I all believe that the 2-year service payback is important to maintain because we need to keep the graduates here longer if we're paying for their tuition. And it's a great value, particularly, considering the high pass rate. Okay, and then the Take Care contribution, I'm glad Mel is here. We are concerned because we're on the last year of funding. We do have clear documentation that when we started using the Take Care funding for mentorship activities, meaning our students every summer and Christmas intersession would go to GMH and they would be paired one-on-one with a nurse. And they would focus primarily on skills and decision making. And we use the Take Care money, and the largest percent of the money actually goes to that. And so we're very concerned that without the continued qualifying certificate, that we are going to have to figure out what to do, of course, and how are we going to augment. And again, the part-time faculty salary, we're only competitive because we have been augmenting with Take Care. It covers a few scholarships only because the majority of students will use the health professions, the NTP scholarship. We do use some of it for equipment. However, in the past few years, we spent it primarily on NCLEX review, faculty, and then mentorship. And then here, I just wanted to point out the employment. Again, we're so grateful to the hospitals. If you see other, it's usually public health, HSP, the home care agencies, Take Care, as well as dialysis units. And so, our graduates are not having difficulty getting jobs. And again, I really want to thank GMH, especially because they've streamlined their hiring process. Department of Labor, we last year launched a partnership where we did an apprenticeship. It was very, very successful. The first one was with GRMC, and we were very happy because Department of Labor partnered with us and GRMC, and we were able to DOL was able to actually cover the tuition. And I want to point out for CNAs, it's very difficult because there's a huge need in the community. We have other programs such as GMTC and GCC, but even with those 2 programs, it wasn't meeting the employment need. And so we decided to start our program, and we started it with the intention of doing the apprenticeships. And I believe even with our 3 programs, and DODEA has a program as well, with our programs, it's still not enough to meet the workforce needs. And so we work collaboratively with them. Every program that's available on the island is needed. And I'm very happy to say that it's not a competition. We meet with Faye and we work very, very well with Dee. And so, any support that any of the programs get, I think is vital to the island. And we can't forget CNA. We focused for many years only on the BSN, but without nursing assistants, there's a huge gap in care, particularly in the home setting. Most of the home and privately hired staff are caregiver and CNA level. And that's been something that's been long neglected. So I'm very appreciative of Department of Labor. We did 2 apprenticeships, and then we have not done another apprenticeship. We are going to meet on Friday with GCC's Denise Mendiola to talk about potentials. And I know, Senator, you and I had talked about that on the phone the other day, to talk about the potential of funding another CNA cohort, because the employers are telling us they really need CNAs again. And they have staff that are working as caregivers that if they upskill them and we put them in an apprenticeship, they're guaranteed an employment, guaranteed a promotion, and they're excellent students. They really know what they want to do, and it really helps the workforce and improves the quality of care. So very, very important. And we really appreciate the assistance from the Board of Nursing, because initially we had a lot of problems with trying to get testing done on time. But the board worked with us and came up with a plan so that for all the 3 programs, GCC, GMTC, they would try to offer the testing for the CNA more frequently. Of course, with COVID, that's, we'll have to deal with that. So with the nursing assistant, we got approval from GBNE in November of 2018, and we started the first cohort with Department of Labor. I want to say that people that, in general, not to, to stigmatize anyone or stereotype, but to CNA students, generally, the majority do not have access to financial aid. CNA programs are not generally at UOG are not covered by financial aid. These are low-paying jobs, and so for somebody to pay tuition is very difficult. And I'm sure Faye can attest to that. And so we did not want to offer a CNA unless we had a funding stream, and only because I don't want to deal with trying to collect tuition. It's very difficult, and I know that these people really need, they can't come up with the money very easily. And so Department of Labor paid for it. The other issue is Department of Labor's apprenticeship pays for the CNA exam. So to become a CNA, you have to take an exam, and it's very difficult. It's costly. You also have to pay for a police and court clearance. You have to pay for your uniforms, everything. There's so many costs that are not included in tuition. So the beauty of the apprenticeship is that it took into account everything, the test, the CPR, all the books and everything, because that's a huge barrier. Now in our first cohort, I have to admit our first take pass rate was not good. It was a very small class of 7 and it was a pilot. But some of the students were from GRMC. They were employees in customer service and security. The others were actually from Department of Labor, and they were people that Department of Labor had actually registered and determined that they would make good candidates for the program. Some of them were single moms. Some of them were on government assistance. And so this was a great way to get them into good employment. So we had them retake, and their retake overall pass rate was very good at 86%. The testing was delayed, but like I said, we worked with GBNE and we improved that. So in our second cohort, they were all employees of Catholic Social Service and HSP, but they weren't certified. And so the agencies really need to certify them, because you can do other skills and you can, as a CNA, that you can't do as a caregiver. And 100% passed their certification exam on the first try. GBNE requires an 80% pass, and so we're very, very happy with that. And keep in mind that many of these students are not your traditional. A lot of them are, of course, they're all working, but many are older. And we're very happy that it was very diverse. We had some Micronesians other than Chamorro. We had some Chamorro and Filipinos, but very diverse group as compared to our BSN students, which are not so diverse. And then our third cohort, unfortunately, we had to put on hold because of the pandemic. And this is partially sponsored by our geriatrics grant from HRSA. Unfortunately, it cannot pay the tuition, but it is able to pay for the books, the faculty, the uniforms, CPR, everything else but tuition. So we were able to drop our rate down to $500, but that's still difficult. It's just difficult. We're gonna have to work on. I'm working with, like I said, with GCC, and I'll probably work with Gita to see if we can get some funding for tuition. There is a list of over 200 people that are interested in becoming CNAs, and this was pre-COVID. And so, it's very distressing for me that we don't have, we just can't get out there and offer these programs when we know there's a need. And our vacancy rate on Guam was 45% in 2018 when I did the last survey. However, we know that that vacancy rate is either the same or might even be higher. But when compared to the US, it's more than double the US vacancy rate. So senators, this is an area we can't ignore. Although we would like to focus on the RN, we really can't ignore the CNA and caregiver. Faye Ovalis and GCC also offer caregiver training. We all need to do it because there's hundreds of caregivers at the agencies like CSS, Guam Behavioral Health, HSP, and they all need training and they need an annual recertification. So between the three of us, we're able to cover it, but it's very, very difficult. I have grant funding now so that our training is actually at no cost. The issue now is really with COVID and trying to come up with a plan for the hands-on for the initial certification. But our recertification is fully online. And so we're very happy about that. And we've just finished 36 recerts in August. And I know GCC and GMTC also helped try to get everybody recertified. But that's very difficult. So our challenges really are our faculty shortage. The president's been allowing me to emergency hire. I have one faculty currently emergency hired for a year. Like I said, we did increase salary. We are looking for maternal, child, and psychiatric nursing. I'm going to work with the administration, but the senior vice president, Dr. Enriquez, has already agreed that I can bring in a nurse from off island who actually is very highly qualified for maternal child. So I'm hopeful that in January, we delayed hiring because of COVID, but also, in light of the budget shortfall, we could make it through the fall by delaying the hiring to January, but we offer a maternal child in January, so I really can't delay that hiring. And like I mentioned before, we're going to get a PC2, and that hiring should be complete within the next couple months. But that's been very difficult for us because it has limited our ability to apply for any more grant funding because we simply can't handle anymore. And I mentioned our retention. We are working on tutoring. Sorry, I know I'm taking too long. Our one thing I wanted to point out though was making sure that we recruit qualified nursing students. There are a lot of people that want to be a nursing student, but we all know that it is difficult. And so we've come up with a plan to really increase our advisement. But unfortunately, that does require more staff and more faculty time. We developed what we call a boot camp, but we're going to change the name. A prep for pre-nursing, but we just haven't been able to come up with the funding yet to offer that. And then with COVID, we couldn't start it this summer. We were going to pilot it this summer with high school students, but that has been a difficulty. There is some funding from HRSA, but we're kind of maxed out right now with with what we're doing. And some of the other challenges, I know, Senator, I mentioned our facilities. These pictures, in order for us to start that nursing assistant training program, we actually had to kick out our RCUOG staff that were in these offices. And this is actually my current office. But in order to start the program, we kept delaying. And finally, we just said, we have to do it. And so GRMC donated us these 2 hospital beds. And you'll see in this photo, it's the faculty. Here's the governor. We're so happy she visited us. But I felt so bad. I call it, and don't anyone be offended, but I really felt that this room, it was a total embarrassment to us because this is their desk. I mean, this is 7 students and the faculty, and this is all I could spare because it was the same time the BSNs were having their program. And so, we just said, we're going to bite the bullet and we're going to find whatever room we can find. And we stuck them in this office, and, Kathleen Moreland was gracious enough to get kicked out and find other space at UOG in order for us to start this program. if we had not started this apprenticeship, we would have lost out on a huge opportunity. And now 4 of these graduates are still working at GRMC. So it's very important. This is our current lab. It's been the same way for decades. We had 9 beds, and until recently, when we got that geriatric grant, we were able to increase the number of beds. That grant provided more beds for us, and we were able to more than double our beds. However, unfortunately, due to COVID, we have to do a lot of social distancing, and we have not used the lab yet because of the stay-at-home orders and the PCOR 1 situation. So we're going to be very limited. In clinical, the law allows us to have 10 students, but in the summer, when we took students to GRMC, we elected to keep it down to 7, which of course will increase the cost of the program, but it's not safe to have 10 students with COVID. And so, that's difficult. The staff spent a lot of time redoing the lab. We also had to convert 1 classroom. This is one of our largest classrooms, and so it was very sad for me to turn it into a lab, but because there's no face-to-face this semester, and this is really temporary, we were able to use this space for that caregiver recertification before the stay-at-home occurred. But as you can see, it's very limited. We can only have 1 faculty, and then, we can really only limit to 6 or 7 students at a time. But it really is on a burden. It is a burden for our staff, our faculty, and myself, to be concerned with the sanitizing and just being exposed. We don't test the students for COVID, which, we will if they go to GMH. But, the risk level is quite high. So it's, I don't know, it's really a difficult juggling act. We were able to use the field house for a few events. However, we're not able to use it this fall, and that's a limiting factor in terms of space. But we did use it in April for the students to get their N95 fit testing before we sent them to GMH, and before we graduated them, so that GMH, they were already all had their N95, which is vitally important to protect them from getting COVID. And this is our faculty, and our staff really helped out a lot with this. Kudos to public health and Xenia. In February, we all got together and started planning. And so I had 2 staff sent to get trained to do the fit testing. And then this is our simulation lab. It's very tiny. We're trying to socially distance, and you can see you can only fit 1 faculty on 1 student. And so we are going to have to work through this as we move forward. But we have 2 simulation mannequins. Well, we have 3, but you can really, because of socially distancing, you can only use 1 at a time. And then, I don't know, sorry, we could go on forever. And then lastly, I just wanted to update you. I know this is not about COVID, but COVID will affect our ability to retain and to increase our numbers of students. So UOG, one thing many people don't know is that HPLO, Xenia, and the governor activated all of us, including GCC, and I'm really proud to say that Xenia, Dia, and I were all activated to the Nursing Resource Command. And immediately, Xenia let us set up a call center to help public health because there wasn't space. And we had a huge room available. And so up until the end of July, we were manning the call center with Dr. Tio Cruz. And it allowed us to have our students also work there alongside nurses from DOE, GCC, and public health. So I really want to stress that, it is a collaboration. All of our faculty, we only have 8 and 1 grant-funded faculty. Our grant-funded faculty was full-time, and now I moved her to GMH full-time, and she's only part-time for us. She works in ICU, so I know they need her more than I do. But I have 3 full-time faculty that are still working at GMH part-time, in addition to their job with us. One is in ER, one is in Med-Surg, and one was at ICU, and currently the one at ICU is just working for us right now. But very, very important. And we will continue to support GMH as much as we can. And again, I mentioned the clinical practicum. We are on hold for the nursing assistant training. We know in order to get them to pass, we need a lot of hours of training. So our training is 160 hours. GBNE requires 120. And since COVID hit, the Centers for Medicaid and Medicare Services has allowed boards of nursing to decrease their requirements. Some places it's as low as 75. So we're working on a proposal to present to GBNE to try to decrease, give us a waiver to decrease the hours, probably to 100 to 120. Not 75 is too low, but so that GCC, GMTC, and myself, and I'm so sorry, Faye, I didn't talk to you about this, but I mentioned it to Dee. I really feel that the full 120 hours is too much of a burden. And while we need it to ensure that they pass, I really feel that we can push out qualified, safe CNAs with lower hours, and then we can bring them back to prepare them for the exam later. And the board can give them temporary CNA certificates so that they can work in response to COVID. And HSP, GMH, and GRMC all told me last week that they do need CNAs. And so I can't stress enough that, I don't know, there's just too many pieces, right, senators? And then we have been helping any way we can. I was able to help them with the testing for the homeless. And I just want you to understand what our faculty are involved in aside from just the BSN program. We had 2 faculty help with GRMC's medic training, and we played a small role, but we're very happy to collaborate. And I'm very happy to say that those medics are at GMH helping now. And so although it was a small part, I'm just very happy that GRMC continues to collaborate with us to ensure that even these abbreviated trainings are very high quality. Our geriatrics grant is still ongoing and is very important. This is Maria Timoteo and staff at the Adult Day Center. Although the centers are closed, we are still collaborating to try to get equipment out to the seniors with dementia, and then to start doing our dementia training again. Our ISA Psychological Services Center is doing dementia geriatric support groups through our school. And there's just a lot of collaboration that we're continuing to do, although I just got to admit, we're tired. I'm tired, but it's just so sorry. I promised I wasn't going to cry, but I'm just so upset because I know the needs, and I can only do so much. So sorry. Sorry. And I see my friends are on the other, all the nurses are here. But Senator, I just don't know how much, more the schools can do. Our faculty have not had a break since March. They worked during spring break. I'm sorry. I just feel that we can't cut short the BSN, but we can't cut short the CNA. I mean, we can't not fund CNA and caregiver. There's hundreds of people in the homes that don't have trained caregivers. And, kudos to GMTC and GCC. We have to do it, but at UOG, our local funding does not support me running caregiver and CNA. I have to find federal funding. I have to do whatever I can. I have to beg people for money from the Endowment Foundation. GNA provides us scholarship money, but I just don't want us to forget. I know you're focusing on RN, but please, we cannot forget that we need CNAs and we need caregivers. UOG could have said we don't want to do CNA and caregiver training, but on a personal note, that we all have family that needs trained caregivers, and so we've all committed to going the extra to doing it. And we worked with DOL, but moving forward, there isn't a good funding stream for CNA and caregiver unless I continue to apply for federal funding. And so I'm so lucky with the geriatric grant, but I mean, I'm at my wit's end. Between GCC and I, Dee and I talk all the time. We don't know how we're going to go back to clinical. The faculty and I, we agreed, we took 44 students. How are we going to go to clinical in PCOR 1? Where it's just very difficult. And I think people that are not in nursing education don't understand the stress. Everyone just thinks, oh, do everything online. Well, you cannot teach a nurse how to do a trach, how to put in a Foley. Simulation can only go so far. If the students never touch a human being and never talk to a real person, I will not graduate a student if I have to teach everything online. And our accrediting body refuses anyway, will not allow us to substitute clinical with only online and with simulation. And so I just really, want to say that unfortunately, it's going to cost more because we can only have small groups in clinical. And we're talking about faculty right now. 2 of the faculty are on a 1.75 FTE because it's the only way we can finish our students, our juniors, and get them through clinical. And I know people will say, oh, well, you're paying them. Well, yeah, we're paying them, but they don't have to do 1.75. That's almost 2 bodies of people, but they're volunteer. I know it's not volunteer because we're paying them, but they're agreeing to do it because they're dedicated nurses. And we have a commitment to the students that are currently in our program. But I'm so sorry. I didn't mean to lose my cool. I apologize. And I'll stop because I know I've gone on way too long. But really, I think Dee and Xenia really will echo my same sentiments. And I just got to really say that, we are, all of us in this, that are in this Zoom, I mean, looking at everybody here, we are just so committed to our students and to the people of Guam. So sorry, I'll stop.
Don't be sorry, please. We are sorry for all of the sacrifices that all of you have made, and we are very grateful. And I know that you're very committed to the teaching because you know the need, and that it's we've all been witness to you and your work and how it's needs based, that you're not just at the school, but you've been out in the community. And so you've been able to actually link the 2 together in a very, very effective way. And that's what we're here to do. And it's not just to focus on the BSN, it's to focus on all of the aspects that you have seen to have to work together. And, you guys are the experts. So we, the senators, we're here to listen to you and to try to do our best to fill the gaps or to strengthen up the things that are very successful at this point, just to keep it going. And we don't want you to sacrifice so much. I mean, but thank you so much. Thank you. All right. I would like to go to GCC now. If that's okay, Dr. Wood. All right. So, President Okada, if you could begin.
Hafa Adai, and thank you, everyone. I'm just going to briefly go through some just overview from the Guam Community College, and then I'll ask our nursing administrator, Dorothy Mangalonia, to go through the details of the various programs. So first of all, I'd like to thank all the senators that have supported the community college for many, many years. We've been quite fortunate in being able to obtain many of the financial resources that are necessary to support the programs that we have. A couple of years ago, GCC did take offline the LPN program, really in efforts to strengthen the program. At that time, our nursing faculty were really getting burnt out because of the short timeline that we had designed the program. And so by the revamping of the program, it has allowed not only the faculty to breathe a little bit in between the learning components, but also the students. Because when you have a very compressed program, students get stressed out. And I see Dr. Hattori, I really empathize with all of the nursing faculty that we have, because I see the burden that has been put on our nursing faculty. To the extent that the community college could expand its programs, I definitely will support the GCC team, primarily because these are areas that we've known for many years that we've needed to provide support for, and we've had difficulties in recruiting faculty members. We've been successful in obtaining financial resources from the Take Care Qualifying Certificate. It has been very instrumental in providing not only the equipment for the nursing programs, but also to support some form of scholarships for our students who go through the program. It provides also resources for students for their review before they take their NCLEX. And it has also provided for professional development opportunities to keep our faculty up to par with the different changes that have been occurring. The college is pursuing additional funding resources. I'm very happy to see Guam Department of Labor here. Phyllis has been a great partner in developing a lot of the programs that we have through apprenticeship. And I will tell you that the last funding that we got from Take Care, we really dedicated that funding for the equipment necessary to pull through this paramedic program that we've been working on for years. And so now that that paramedic program has launched, we've actually submitted our recent Take Care grant application again to go back into building support for our nursing program. But in that grant application, we also included the science component, the equipment necessary for our science faculty, because they are part of our nursing program as well in providing some of the courses to support the students. And so, and there are other grant opportunities that we have been pursuing. We are working with GITA. We do have great partnerships with many of the clinics here on island, of course, with the University of Guam. And I mentioned Guam Department of Labor earlier. We have been in close collaboration and contact with GRMC because they have a definite need, but also reaching out to our partners at the Northern Marianas College as well. So that's an important component for the GCC nursing program. And for the details on the different courses and the cohorts and some of the challenges or restrictions of being able to expand those programs, I'd like Dorothy Mangalotnia to cover that component. So thank you very much again for all of the support and just for listening to all the different areas on how we can all work together to expand what we know is a growing need for our community. So, Sijus Masti, Senator.
Algo más, President Okada. Dee?
Half a day, everybody. Just to correct, my name is Dorothy Duenas, and I'm the Nursing and Allied Health Administrator. So the three main nursing programs that we have, or actually the two main nursing programs that we have, are the Associate of Science in Practical Nursing and the CNA course, which is an industry certificate. It's just one course, 1 semester long. But just to talk first about the practical nursing program. This is a new program that was started in fall 2019. The Associate of Science in Practical Nursing program is 5 semesters long, which includes general education credits. The last 3 semesters are for your core nursing courses. We had a total of 59 students who registered and declared for the practical nursing program in fall 2019. Because of our board requirements, we were only able to select 20 students to start this cohort. And this is the first full year of our Associate of Science in Practical Nursing cohort. And they should be completing this fall, but with COVID, we may have a slight delay. A lot of our students, practically 95% of our students, are actually working in public health and in other agencies to respond for the COVID response, in addition to our 3 full-time faculty who are still responding on a part-time basis for the COVID. This coming cohort, we're looking at starting another cohort in spring 2021. We have had 40 applicants, but right now, because we are limited by board regulations, we can only accept 20 students. Once we have a full successful completion of our first cohort, then we may be able to present to the Guam Board of Nursing any proposed changes to increase our class size or look at doing simultaneous cohorts. So that's the only challenge. We would like to have more students simultaneously running through our programs in order to meet the needs of the community. But for now, we have to abide by the rules of the Guam Board of Nursing, since we are a new program, and start off with our 20 student cycle, just to ensure the success of our students. Another challenge that presents or poses for the practical nursing program is the difficulty with hiring for nursing faculty. As Dr. Margaret has mentioned, it is hard to hire nursing faculty to meet the different specialties within our programs. So right now, GCC only has 3 full-time faculty. 2 of them have their master's and 1 of them has their bachelor's. We also have a doctorate prepared adjunct faculty who assists us with clinicals and also with lectures every now and then when we do need them. We are constantly encouraging our students to continue their education as well as enhance their careers. And so we always try to work with the University of Guam to see how our students can articulate whether it is their general education credits or if they can have or challenge a course such as the Foundations course. UOG has been able to partner with us very well in allowing our students to test out of the Foundations courses for our practical nursing students who have completed and who have become licensed. So that is an opportunity that our students are able to avail of if they desire to continue their education, which we always encourage them to do. A recent thing that we have or idea that we have looked into because we know that there is such a great need, and there's so many nurses, so many graduates of our program who have looked and sought different ways to, get a higher degree. And so we have also reached out by the nudge of GRMC. We reached out to Northern Marianas College to see how we can possibly articulate some of our courses to their associate's program, because they also have an associate RN program. So they are currently reviewing our curriculum to see how they can also help us in putting out associate RNs. We strongly encourage our students to first complete our program and become licensed, take the NCLEX and become licensed LPNs, and then continue with their education. That is the main objective for our associates program. The next course that we have is the Certified Nursing Assistant. This is 145 hours, 1 semester long. The average cohort for our CNA course it's between 10 to 13. We have been having small cohorts for our program recently, however, and I think it's due to COVID, we had to cancel the most recent semester. We had a low enrollment. We had a lot of students initially who were interested in trying to apply and take the CNA course, but once we started requesting for registration and trying to assist students with registration, we only actually had 4 students come in and register. And so due to low enrollment, we had to cancel that course. However, we are not stopping with our efforts to try to recruit for CNAs. As Dr. Margaret has mentioned, we are having a meeting to try to recruit and see if we can offer CNA courses down the line. Because it's only 145 hours, we do have that leeway to offer a CNA course that doesn't fit within the traditional semester. So that's one thing that we do appreciate. The CNA course is not, the students who register for the CNA course at GCC aren't able to avail of financial aid, as Dr. Margaret has mentioned. So at GCC, the student typically will pay approximately $733, and this does not include books and uniforms and all other things that they may need for the course. It also does not pay for their exam at the end, which is one of the other things that has been a challenge for us. Is after we we complete or have students complete and graduate from the CNA course, we try to ensure that the students take the exam in a timely manner. Like Dr. Margaret mentioned, within 3 to 6 months. Once they're going past 3 months, they're really pushing it, especially for the CNA course. So we have used Take Care to assist us with paying for the students' exam fees and also helping the students to have prep courses in order so that they may be very well prepared to test for the CNA exam. Another difficulty that we have had, though, is just timely testing for the Guam Board of Nursing. I know that it's difficult, especially with COVID, for the different schools. GCC puts out an average of 13. UOG has their cohort. Guam Marianas Training has their cohort, and DOD has their cohort of students that need to test for CNA. And GB&E only has a limited amount of participants who volunteer their time to test the students. And so it has been difficult to schedule testing, but each school is working really closely with GB&E to try to schedule for testing. I think the big thing is that if they can have more volunteers to help with testing, I think that might help them. But I think also right now with COVID, that's been something that's posed a great challenge for all the CNA graduates. But thankfully, through the Guam Board of Nursing and the Health Professional Licensing Office, a lot of our CNA completers, even though they have not tested yet, they have been able to obtain temporary work permits, and they're already out there working and assisting with the COVID response. So we're very, very thankful of that. GCC has offered to partner with GB&E in case they needed a site for testing. So that's something that we're working with the Guam Board of Nursing on to help so that students can get tested once PCOR 1 is lifted. So we are always offering our caregiver, home health aid, EMT and medical assisting courses. I plug in EMT because EMTs can be used and can be hired as ER techs in the hospital. A lot of our EMTs are used as ER techs. And Dr. Margaret mentioned that the medics that were trained at GRMC are currently working at GMH. So we do offer the EMT course at GCC. So that's basically it in regards to GCC's nursing programs.
Thank you, Dee. Can you just specify that home health is a separate program?
So we have our caregiver and home health. We have offered our home health aid course in the past. We have a home health curriculum that our secondary students actually avail of in their secondary curriculum.
All right. Okay, thank you very much.
Thank you.
Appreciate all this. And I'm going to move on now to the Marianas Training Center. Ms. Ovales, right there, but Ms. Valencia Ovales.
Community. Guam Marianas Training Center was established in 2004. We were one of the first private institutions that was approved with the Guam Board of Nurse Examiner to offer the Certified Nursing Assistant Program. It evolved from there on. We have offered other various courses with US certification. In the administrative field, we have the Certified Billing and Coding Specialist. And on the clinical side, we have Certified Dental Assistant Program. We have the Home Health Aid as well. That does not require certification. but requires so many hours of training, hands-on and classroom as well. We have also the CNA program, of course. We have the Certified Pharmacy Technician program. Our examinations are to the PTCB and with the NHA as well, which is the benchmark in allied health certification. Certified phlebotomy technicians and certified physical therapy aid. To this point at this juncture, both Guam and the CNMI, we also have classrooms in the CNMI. We have graduated close to 3,200 of different allied health specialties. Billing and coding was one of the primary courses that the CNMI first asked us to offer because they would like to be able to train their revenue cycle people in making sure that their billing and coding are on time and are able to collect in the right and proper manner and the right engagement. Very successful indeed. They were able to really credit the training to Guam Mayanas Training Center for being able to get all their dramatically improve their billing and collections in the CNMI. Our graduates our students only requires high school graduation. Since inception in 2004, our graduates are all over the nation. Of course, Guam and the CNMI. We have strictly direct enrollment right now. We are an approved training provider for both Guam and CNMI with the WIA program under the ETPL, and I think, I don't know if Mr. Lake, my executive director, will be able to give you a virtual tour of the classroom. Our GMTC students are truly a microcosm of the island of Guam and the CNMI. We have given hope and lifetime careers to the members of the community. As you know, Senator, allied health is truly an allied health. Is really a lifetime career. Truly recession proof, because these are the members of the community that's always needed 24/7 and 365 days in the year. I couldn't sympathize anymore with Dr. Margaret in her sentiments, because we truly have a lot of people that would like to get into the CNA program and the other various technician program that the hospital so needed that I provide under the Guam Mayanas Training Center. Our phlebotomists are certainly needed now in our labs right now. And in all this COVID testing that we're engaged with. And thank God they are there. The waiver was also given by GBNE to us, to our recent cohort, and they are now helping the GMH in taking care of some of our patients. Not much to talk about us. We continue to do 100% virtual. The issues on some of the demonstration, the return demonstration aspect of SNA is practically curtailed right now because of the COVID. We have various MOUs with different hospitals and clinics to be able to get the true and personal experience of our nursing students, our NA students, to be able to see what really a complete hospital and patient care is all about. That is now cut down. Hopefully, with Dr. Margaret working with GBNE, that there'll be a waiver, because the whole nations of different jurisdictions have waivers for all of the NA for all of the NA classes. GBNE doesn't have it in place. The law doesn't specifically say that you have an approved facility that you can do a lot of your practical clinicals. It's fine. But the 120 by law, I certainly have upped it up to 160 to include more clinicals and more return demonstration aspect of the nursing program. And it's needed, because a lot of the facilities that we used to have MOUs are now asking us not to come in, and it's both for the protection of our students and their patient as well. So thank you, Dr. Margaret, for moving in and spearheading that. You don't have to tell me. I pray that you do it. Thank you. This collaboration with UOG, GCC, and everybody here, Senator, is really beautiful for our small island. And as our island moves into getting more of this curve, we only need to make sure that this apprenticeship program really works. How many apprenticeship programs can we create? GRMC is locked in with UOG, and where do I come in to put in my graduates to do the same thing? I like to be able to do apprenticeship program with them too on the phlebotomy side. Guam Mental Health, GBWU, our Guam Behavioral clinic is also asking for mental health technician. We developed the course, and we'll be launching it probably by next year. So those will also be entry level mental health tech. We're striving so hard to be able to offer a lot here in our island. And we really need some of our students that are economically challenged, more so now, Senator. A lot of these people, according to Dave Del Sola, director of DOL, the the uh, the uh, the income criteria will now be lowered or not be any more part of the criteria when these students come into UOG or GCC to be able to get some of this training, especially in our training. We do not have currently any funding from any of this WIOA right now. But we are a qualified ETPL. Um, a federal, we are a qualified institution also to be able to get our students under this funding. So we mostly direct, we're mostly 100% virtual right now, on all of the aspects of our training. We have a new batch of students. Our cohort is maintained at 15, level of 15 students at a time at each time. So we have 3 sessions in a year. Um, as I said, we have graduated we pride ourselves, Senator, with the National Health Career Association, as we have actually exceeded the benchmark of this group to be able to have Guam as the highest in all of our national certification exam. Um, on an 82% of the NHA average, we were able to do 84% here in Guam in all our island health examinations or national certifications. So we're so proud to be able to say that in a tiny island like Guam, we're graduating all of these um, allied health certifications. They're all over the nation center. They're all different jurisdictions because our US certification is portable. So they can take it anywhere. They can, their military dependents, they are first hire when they go to all the different jurisdictions or different other areas where they will be serving husbands or wives that are in those different military installations. So we need help, as Margaret actually had identified all the different issues that we will have on the NA program, which is so much in demand right now. I do not have any, as far as like the other courses are concerned, they are well subscribed. As I said, it's only the travel that is really restricting my students. Once they get the year certification, they're begging to go outside because sometimes the salary also is an issue. And I think that's something that should be benchmarked at one point in time on the allied health field. Because Dr. Margaret was right. At one point in time, we cannot. Our NAs rather go back before when the hotels were really doing so well. They would rather go back to the hotel and serve because their salary does not even pay good as far as like versus doing hotel work. So it's in those areas, Senator, that I think that needs to be really worked on. There's got to be some sort of like salary, sort of a base salary that needs to be given to some of our allied health practitioners. They really are needed in the community. Masaya, even if they are on the technician level, because that's all where the hard work is. My pharmacy tech are hard at work in all of the different pharmacy area now that prescriptions after prescriptions are being prepared by all the different pharmaceutical clinics, right, and so on and so forth. So, Senator, the challenges is really just on some of the on the funding that will be available for some of these students. Right now, we're all in direct enrollment, which covers, once you have a direct enrollment with us, your tuition covers everything, including your examination, the notary, and NY review. We do all those for our students. So they don't have to go in hardship into like trying to obtain um, some sort of website to get in to be able to log in their exam. We do that all for them, and then we just locked in the exam. They stay in our classroom. It's all electronic, so there's a time exam, and then they do it. And we're doing so well in the nation. We as I said, the same challenges that everybody have right now is really what the Guamayanas training have, and maybe more so on their areas because as we said, all our instructors are all US certified. They're all local. They're all from here. They all have maintained many years of experience and love for the profession, and we are so blessed to have them in our school. And we will continue to serve our island and be able to get more of our students between Guam and the St. Island to be part of the allied health community, more so now that it's needed. Thank you, Senator.
Thank you. Thank you very much. Okay, we're going to go now to the, I think we're going to hear from the Department of Labor. If, Phyllis, trying to see you here. Can you wave your hand?
Hi.
Oh, there you are. Okay, great. Phil, Mr.
Okay,
Pasta.
hi.
Yes.
Wow. Well, thank you, Madam Chair, for having us participate in this conference. Just a whole lot of information, and I see a lot of our partners out there. Dr. Margaret, hi, Dr. Margaret. I know we're starting to work with GCC in looking at the CNA program and the LPN program, see how we can help out. I work mainly with the apprenticeship program, but I also wanted to talk a little bit about the different types of funding sources that are available out there that we've utilized as part of our program. But I did want to say that with the Certified Nursing Assistant program with Dr. Margaret, we were very strong in our determination to make sure that all of the participants in the CNA program passed the NCLEX, and Dr. Margaret and her team just worked very closely with the cohorts, the two cohorts that we were able to pay for, to ensure that, you know, whatever they needed, whatever support they needed to pass that NCLEX was provided. So we really appreciate that, and that was, I think, one of the reasons why the pass rate was very, very high, especially with the second cohort. Unfortunately, the funding source that we had that paid for those two cohorts expires, I think, at the end of September. And while we have a grant right now, we didn't really focus on allied health with the current grant that we have, although it's, you know, it's not to say that we can't go in and modify our funding, our industries. It's just that the funding that we got first time around was phenomenal. We were able to pay for the entire tuition, and that took care of books, any other related fees, I think personal protective equipment that was required. And the funding that I have now is very, very limited. It barely even covers half of what we were able to pay with the first and second cohorts. But I'm digressing because we have a lot of apprenticeship programs with allied health. Nursing assistant, of course, is one of them. The LPN nurse is one of them, the home health care aide. I know we partnered very closely with Guam Fire Department and GCC with their paramedic program, which just launched a couple of months ago. But we also have the medical coder, medical assistant, medical secretary, transcriptionist, lab technicians. Those are all apprenticeable occupations, including the phlebotomist occupation that Faye talked about. So it's just getting employers to want to get into the apprenticeship program. And one of the challenges that they have with that is when an individual becomes an apprentice, they are already an employee of that company. And then, we have to look at funding sources for the related training side of the house. And GCC has been a really, really great partner in terms of using the manpower development funds that is set aside specifically for the apprenticeship program. But funding is really an issue. So one of the programs that we have here at the American Job Center, which is really what the American Job Center is all about, is the WIOA program, the Workforce Innovations Opportunities Act. So we have a work experience program that we get our participants engaged in, and work experience in, I want to say, entry-level type of positions that can be supported with classroom-related training. And we can provide funding for that. Of course, there's always a caveat with federal funding. These individuals must be individuals with barriers to employment. They're the priority. And if they meet our program requirements, then we have no problems putting them into a work experience program. We partner with employers that can provide the hands-on training, and then we also go with our eligible training providers who can provide the classroom training. We also have what's called the on-the-job training program, which is a contract between the employer and the participant, and of course the Guam Department of Labor, with the participant receiving above minimum wage and the employer agreeing to pay for 50% of that individual's salary during the during that training program. Department of Labor will pay the other 50%. And we've used this program in the past with apprenticeship programs with Guam Waterworks, Guam Power Authority, Guam Technical Institute, Guam Shipyard, where they use the WIOA funding to provide OJT and classroom-related training for their apprenticeship programs. So that's another funding source that we could avail of. We also have the Dislocated Worker Program here at the Guam Department of Labor. We were recently granted funding for the National Dislocated Workers Program in line with COVID. It's due to individuals, it's due to general economic conditions or as a result of natural disasters where individuals are either terminated, laid off from their jobs, or furloughed with no return date in the near future. So it's skills training that we can provide here at the Guam Department of Labor. We also have what we call the Incumbent Worker Program. And this is a partnership with employers who have underskilled individuals that they want to upskill. And there is a sliding scale, and with the employer, having to pay a certain percentage of the training program that's required to upskill these individuals. And then it's just a matter of contacting us here at the Guam Department of Labor, our Business Services Unit, if they are employers, so that we can let them know what the programs are that they can avail of and what the requirements are, so that we can get them on the bandwagon here at the Guam Department of Labor. It's pretty much all I have right now, unless anybody has questions.
All right,
Thank
I
you.
appreciate it. Something, Doris, that you said that ran out. What is that for the CNA, the one you used for the CNA program before? The two.
We had what was called the State Apprenticeship Expansion Grant, which was funding from the federal government. And we used a portion of those funds for allied health. And so we worked very closely with the University of Guam to develop that CNA program. Unfortunately, with again, funding was not available for a third cohort, but in hearing Dr. Margaret talk about the third cohort that she has, we may be able to, provide funding for that. So I'm going to go ahead and contact her and see how we can partner with her on that. Okay. All right,
great. It seems like all three of these learning institutions could use some of that partnership.
Yes.
For the
they are all our eligible training provider. They're on our eligible training provider list. And so we've utilized their services to provide training to our participants here at the Guam Department of Labor who engage in the American Job Center.
Yes, thank you so much. Very important. And I want everyone to hear that. So thank you very much, Mr. Pasna.
Thank you.
And I'm very sorry, I've been remiss that my Vice Chair, Senator Sabina Perez, has been here all this while and I failed to recognize her. My fault, and I'm sorry about that, but if I could please recognize her. And thank you for attending, Senator Sabina Perez. We're gonna move now to the Guam Board of Nurse Examiners and then the Guam Nurse Association. Thank you for your patience, everyone, but thank you for the thorough information as well. Guam Board of Nurse Examiners.
Hi, good afternoon, Madam Chair and members.
Okay, is that Bernadette or Xenia? Oh, okay. The chairperson? Yeah. Here? Okay.
I'm going to go ahead and start, and then Bernadette would jump in. So good afternoon to Madam Chair and members of the 35th Guam Legislature. So my name is Zena Pacina, a registered nurse and the administrator of the Health Professional Licensing Office /EMS, and also the executive director for the Guam Board of Nurse Examiners. Now, bear in mind that was pre-COVID. Post-COVID, I then became in charge of the Nursing Resource Command for the Department of Public Health and Social Services. So I can't thank my colleagues enough, Dr. Margaret Ochima, Dee, Rose Greeno, and other members, other colleagues that have really jumped in and helped me to get this set, because we have not stopped since March. Here we are in September, and we're still going full force. So many of us are pretty exhausted. We still continue to work 24/7. That's in the office and out in the field. But I wanted to thank you for this opportunity to speak on behalf of the Guam Board of Nurse Examiners, because many times you hear of the University of Guam School of Nursing, you hear of the Guam Community College Nursing and Allied Health Programs, you also hear about the Guam Nurses Association, but very few, not often enough do you hear about the Guam Board of Nurse Examiners. And again, and their role in the nursing community. So again, pre-COVID, one of our strategic plans was to actually get out there in the media so that people know that the Guam Board of Nurse Examiners is here and available, and is available to help other agencies and clinics and hospitals advance and approve whatever programs they want to institute in their organization. So I'm hoping that we can still do that as soon as we recover from COVID. Now, the Guam Board of Nurse Examiners is a 7-member board made up of nurses from various agencies. So we do get input from the community. We have Bernadette Santos, who is our chairperson and our community RN member. We also have Christine Taquero, who is our vice chairperson and our hospital member. So she takes care of the hospital, GMH, and GRMC, and maybe a little bit of Naval Hospital needs as well. We also have Relita Samayo, who is our public health member. So she takes care of all the public health needs. We also have Dr. Anna Varghese, who is our university member. Kevin Hitosis, who represents the APRN, that's the Advanced Practice Registered Nurses. And also Brenda Manzana, who is our LPN member. And Lisa Dames, who is our public member. So we have a good makeup of the board that represents the entire island. So the Guam Board of Nurse Examiners' mission is to safeguard the people of Guam by imposing regulations and ensuring that practitioners are qualified and competent to practice. Now, that is our number one mission, is whatever programs are set forth, we must ensure that it is safe and it is safe before approval. To date, we have licensed 70 advanced practice registered nurses. We have 1,205 registered nurses. We have 169 licensed practical nurses and 368 certified nursing assistants. So you think about the population of Guam, that is such a short number for healthcare, for nurses on Guam. Now, the Board of Nursing ensures a long-time quality nurse workforce. How do we do that? We do that by continuing to provide guidance and support educational institutions with programs that they've instituted, and also to guide them in training plans for approval. We also continue to meet with local nurse leaders. We have what's called the Commission on Nurse Leaders, and we're currently working on strategies to increase the nurse workforce. So we're looking at that. Pre-COVID, we were meeting at least once a month. Post-COVID, we have not met at all. We also we've approved several programs submitted by the University of Guam and GCC. So we have the LPN to ADN program. That is a new program that GCC has recently launched, and we're really looking forward to the outcome of that. I have to tell you that our NCSBN, our national partners in the mainland, are really looking at Guam's program, their LPN to ADN program, because if that's a success, they want to engage and promote that program to other states. They're also trying to grow their workforce. We've also, we're trying to think out of the box to come up with creative and innovative ways to move nursing forward. And I think we've proven that post-COVID. Our office became the Nursing Resource Command. We had nursing leaders from the University of Guam, from the hospitals, from other agencies that were trying to think of how can we expand our workforce to cover the needs of our community during the first surge, and most especially with the second surge that we are seeing now. So some of the things we've done to expand our workforce within our means is, and to make sure that we're safe as well, is we've nurses that were foreign graduates, we've actually given them emergency temporary work permits to practice. And we've worked with the agencies to make sure that they were safe to practice, making sure that they were supervised. We also looked at all the nursing programs, the LPNs, the RNs that were close to graduating, and approved approved their early graduation. We've also provided them other means, like with our CNA programs that were our CNAs that have not, or actually, I'm sorry, going back to our RNs and LPNs who have not taken the exam yet. We've also provided them emergency temporary work permits in order for them to practice. And these individuals are closely monitored in all the respective agencies. And so far, it's been proving pretty successful. I have to say that the Department of Public Health has hired many of the GCC CNAs and LPNs, and they've been functioning independently. We monitored them for the first couple of weeks, and just to see where they've come, how far they've come along is pretty impressive. So I was really, I spoke to Dee and I said, I'm really impressed with their program at GCC because of the quality of nurses that they're producing, as by observing. So other things that we are working on, also we're encouraging all the other agencies who have thought of other programs to implement to please come before the board and present your ideas, because those are things that we're looking for. There is no one wrong idea and there's no one right. I think this pandemic has been pretty challenging for everyone, and it also posed it just showed how resilient the nursing leaders and the nursing workforce has been. We've all put our heads together. We're trying to find ways to stretch out our current workforce, and also thinking of ways to not lose them in the process, because that's one of the things that we need to really consider, is not losing that workforce. So like Dr. Margaret, I'm really exhausted. I think yesterday was the first time I actually took I took a mental break, because we have not stopped yet. So we have so much to do yet. And so I'm really looking forward to this meeting. I'm going to turn it over to our chair, Bernadette Santos.
Thank you very much.
Hi, good afternoon, Senator, and to all of the wonderful nurses on this call. Xenia and I happen to have had the same bullet points, it looks like, as far as what we would be reporting for this meeting. So I guess I could keep it quite brief. Again, my name is Bernadette Santos. I've been on the board for about maybe 5 years now. I'm on my second year as a chairperson. You wouldn't think that Xenia just started with us, but I think it's only been just over a year, but she really hit the ground running with a lot of programs for GBNE, one to include kind of picking up where Marlene was working on the nurse licensure compact. And so I just add a couple, in addition to what Xenia has mentioned today, of course, GB committed to public safety and to, of course, upholding the statute within the Nurse Practice Act and our rules and regs. So with regards to any measures that to ensure the island is equipped with a long-term quality nurse workforce, of course, you've already heard the other programs talk about what they've implemented. It was my first time going through the process of, for example, for the LPN program at GCC with their new associate's degree program. It was a very interesting process, and we continue to work through that with the guidelines in our statute. The NLC, of course, is something that will be coming up later on this month, but that could help to expand telehealth nursing for our island. As far as challenges with certifying residents as nurses or nurse assistants, we've heard from all the other programs. There have been some issues with testing, and I believe that we had worked through that before COVID. Thank you again to GCC for opening up your facility for us to resume the testing once we get out of PCOR 1. We really look forward to that. Let's see, Xenia mentioned the emergency temporary work permits. I guess what I would ask of the programs is just to continue your communications with the board as far as what we can do. We are we do our best to try to accommodate, and as Dr. Margaret was saying, if there's new recommendations from Medicare as far as hours for certain programs, we're of course open to that. Unfortunately, Dr. Varghese, who's our wonderful education member, was unable to make it today. She's doing clinicals with students, but I do want to recognize the past board members. And Dr. Wood, I just learned that you were retiring, but you're so instrumental being on the board and being the education member. So just wanted to thank you for that. Otherwise, I don't think I have anything else unless you guys have any questions for us. Thank you.
And just real quickly, are the testing fees imposed by the GBNE, or are those national NCLEX, or CNA fees, the CNA?
By GBNE, and I believe they're among the lowest in the nation. In fact, I think we've been encouraged to try to look at them and raise them, but we have not on the time I've been in the board.
All right. Appreciate that. Thank you very much. And I know Dr. Hitosis is the vice chair, co-chair. Thank you. We will go now to the Guam Nurse Association. Where did I get that? Ms. Greeno, Rose?
Hi, can you hear me again?
There you are. Yes, thank you.
Yes. Good afternoon, senators, and of course the rest of my nursing colleagues and our other attendees this afternoon. Thank you so much. My name is Rose Greeno. I'm the GNA president. Along with me present right now on this session is our Vice President, Susan Lobatan, and our Executive Director, Ms. Glynis Almonte. We actually prepared a write-up, and you heard all the institutions and you heard from the GBNE. I think I want to read the write-up that we prepared and somehow give you guys have a recap and also shared with you as what does an association have contributed and the initiatives that we are working on along with the different stakeholders. So if I may, I'll just go ahead and read the write-up that we have, and I shared it actually in the chat. Your guys are free to download. So the nursing workforce is a critical component to tackling the issues our healthcare systems face across the nation in our community. Our current COVID-19 pandemic has shined a bright light and magnified the already existing challenges within our healthcare system and workforce. Staff shortages brought about by cost-cutting decisions, an aging population, increase in patient complexities, and an aging workforce place an insurmountable stress on working conditions for nurses. All of this have implications and significant impact in the quality of patient care delivered and on overall overall health outcomes. The Guam Nurses Association and its members have provided a long-standing service in collaboration with our island's learning institutions. GNA has facilitated the maintenance and advancement of Guam nursing workforce by creating a network of agencies across the island with nurses who serve as clinical preceptors, instructors, advisors, and mentors. GNA, along with the American Nurses Association, is committed to the transformation of health and healthcare delivery by equipping our members and all nurses with the latest evidence-based research, policies, practices, professional development, and advocating for safe staffing and a safe work environment. RMI, I'm going to share with you some of GNA's initiatives aimed at improving the quality of our nursing workforce and promoting the nursing profession on Guam. We'll start with training and certification. GNA officers and members serve as preceptors, instructors, guest speaker, and an advisory council to the University of Guam, then Guam Community College, and the Guam Mariana Center. We offer continuing education to nurses and other allied health providers for their license and certification maintenance, and keeping nurses up to date with current evidence-based research and practices. We also offer a scholarship for UOG nursing students and RN to pursue their advanced degrees. NA through the American Nursing Credentialing Center offers credentialing certification to nurses to advance their profession and specialty. Discounted rates are offered to the GNA members. We also work on marketing to promote nurses and the nursing profession. So we participated in Career Day in a different middle and high schools to promote the nursing profession, as we wanted to start it early in this student young minds. In collaboration with media, GNA highlights the many phases of nursing and the impact of nursing profession to patients in the community. And we started that actually with Dr. Margaret Chima, and every Thursday I invited you to hear that with our partnership with KUAM, as you can hear the different faces of our nurses at the different healthcare settings. We also recognize and award the accomplishment and contribution of nurses through the recognition and awards program annually. We are strong on policy and advocacy. GNA represents all of our Guam nurses and healthcare at the annual American Nurses Association Membership Assembly, where GNA is allotted 2 equal votes, same as the other states, towards electing the ANA leadership office for elections annually, and also on their elections and any policies that affects nursing practice. So GNA, as I mentioned, votes on policies on the ANA national agenda. This is also impact the nursing profession and healthcare system. GNA voted in favor for the adoption of the ANA safe staffing policy, which takes into account the following: RN educational preparation, professional certification, and level of clinical experience, the number and capacity of available healthcare personnel, geography of a unit, available technology, and the intensity, complexity, and the stability of patients. Just imagine now, this is even more complex with what we're dealing with the COVID-19. Advocate for advanced practice registered nurse APRN full practice authority, which became a public law 34-78. This brought our island's full and direct access to the nurse practitioners and other APRNs at Guam. And I know Dr. Kevin Hitosis is here and the pioneer for that. And I have Senator, the other senators from Camacho Torres. I know you were there present during our thank you for that support as well. We also lobbied in Congress for the Title VIII Workforce Reauthorization Act of 2019, which passed in the House to battle nursing shortages and reauthorize nursing workforce development programs. We urge a congressman to co-sponsor Workplace Violence Prevention for Health and Social Services Workers Act, which ultimately passed in the House in November 2019. This will help end the nurse abuse. So let's just share with everybody. And every June of the year, we attend the membership assembly, and also that's also the time that we do the lobby day at the Congress for any initiatives that impact nursing profession and even in the healthcare system. We participated in the efforts toward medical assistant bill for unlicensed assistive personnel to be regulated under the Guam Board of Nurse Examiner as previously proposed. We also lobbied in the former Congresswoman's office on the H-1 visa for foreign nurses. Through our partners and supporters, JNA has donated PPEs for the protection of our frontliners in order to promote a workplace safety and create a safe workplace environment for all. So there have some of the recommendations from the GNA. GNA's recommendation for support is to resurrect the unlicensed assisted personnel medical assistant bill, regulating the unlicensed personnel and recognizing their role as part of the healthcare system. Encourage our policymakers to update the nursing profession status under H-1 visa as professionals in an effort to allow Guam private and public agencies to hire foreign nurses to alleviate the nursing shortage. So as we heard earlier, with the three institutions, we still cannot able to meet, and the number of nurses that Sinya shared, the demands of our the needs of our community. Encourage the healthcare facility to implement safe staffing and safe work environment. This is so important for the retention of the nursing workforce. Appropriately fund and provide GB&E with tools and resources aimed at facilitating the processing and monitoring of nursing licenses and certifications. The nursing workforce is key to tackling the problems in our healthcare system face today and beyond. Collaborative efforts and a collective approach toward workforce management and a safe staffing nursing levels are imperative in addressing this critical issue. And I'm very humbled and happy that we all have this together. Thank you, Senators, for having this venue for us to have these discussions in a very critical issue that we face today. Thank you so much. I invite Glynis and Susan if there's anything you might wanna add in this.
No, thank you. You did a good job, President Rose. Thank you, Senator Terlaje, and all the senators in this meeting, and also all my colleagues. We're all doing a great job for our community. Thank you.
Thank you very much. Thank you, President Rose and Glynis, Suzanne, and all your team for all the work. And I very much appreciate your recommendations. So we'll take a close look at those. Thank you. And I know you've submitted it on the chat, so all the senators have access to it immediately. Thank you very much. All right, I'm gonna keep going. So if we could hear now from the Guam Economic Development Authority, please.
Howdy, Madam Chair. Howdy, everyone. My name is Mel Mendiola, and I'm the administrator at the Guam Economic Development Authority. I just wanted to share, kind of before I start, that you know, I thought I work hard. I know I work hard, in fact, but I know that I don't think that compares to really what we got in the room right now. And I think you have a lot of, I think the senators, you have a lot of firepower in the room right now when it comes to the medical community. And so I think it's, I have a lot of admiration. And I think in addition to putting in the hours, like many of us, unlike many of us, you guys put in the heart. And I think that's what's really special about this group. So I wanted to talk about GIDA's role in the healthcare industry prior to COVID, and then kind of how we've kind of evolved in recent months. And so last year at the change in administration, we inherited the CEDS, the Comprehensive Economic Development Strategy, which was then our role to continue to expand, firm up, and submit to the U.S. Economic Development Administration. The importance of the CEDS is primarily a tool to be utilized in obtaining grants from entities like the US EDA as well as the USDA. And so at the time, the Guam Economic Development Authority engaged the University of Guam, GCC, other stakeholders, et cetera. Two projects ended up in the SEDS that was submitted last year. One was a UOG capital improvement for healthcare, education, and employment opportunities. And the other was a feasibility for a new hospital facility. And I'd actually like to point out that Senator Taitigui was the one that brought it to our attention and said that we should put this in the SEDS, and it belonged in the SEDS, the latter project, and that's how it ended up in the SEDS. The UOG capital improvement for healthcare, education, and employment opportunities is a construction project, and it has to do with increasing the infrastructure of the School of Health so that they might be able to offer expanded classroom opportunities. They have since turned this into an application to the U.S. Economic Development Administration. It is now going through the vetting process. We supported this application completely. One special thing of note is that and Dr. Hattori, we shared this in a recent meeting, was that the application includes all the costs of construction and renovation of the School of Health, but it does not include equipment. And so then I'll talk about that in just a few moments. And so the SEDS and supporting projects having to do with the SEDS was largely our involvement in healthcare leading up to, as well as any kind of financial, if we were asked to look into lending types of products and things along those lines, we could do that as well on behalf of the different government agencies, as many of you are aware. So since the COVID pandemic, well, right around the time of the COVID pandemic, we were also starting to do some research concerning home healthcare. We have one director of our board of directors. Her name is Gia Ramos, and Director Gia is very interested in assisted living facilities, and was very interested in extending the ability to receive Medicaid reimbursement, not only to facilities, but also to home healthcare facilities. And so that was the bulk of the work we did prior to the pandemic again. So since the pandemic, what we've started to do is we did some research, and some of the initial research that we did was, and I'm sorry I can't cite the actual year this is as of, but I believe the second fastest growing industry when it comes to jobs is healthcare, with the first being technology. I'm sure technology and healthcare probably are close, probably tie for first right around now. And so given that, we said, we're the Guam Economic Development Authority, we can't ignore this. And so we started to do a little bit more research. And we asked Director Gia if she'd be willing to chair a healthcare committee, which the board then adopted or ratified in I believe it was the July meeting of this year. And so what we found out in our healthcare, in doing the research, was that compared to other jurisdictions, Guam is underserved, not only in areas of doctors and nurses, practitioners, health and technical occupations, healthcare support occupations, all of the occupations referenced earlier. Underserved by approximately 4,000 positions. So if you think about it, if there's 40,000 people, close to 40,000 people getting some type of unemployment benefit, that is, we can shift nearly 10%. We can retool these individuals into the healthcare occupation. I think that would be a very, very ambitious goal for this, for the body. And so the ways that we've been trying to do that is by putting together our healthcare committee. And so the healthcare committee met on July 17th, made up of course, our board of director, Gia Ramos, myself. We invited representatives from, so Dorothy from the Guam Community College, Dorothy Duenas was there, as well as Dr. Hattori. Representative from GRMC was also there at the time. It was a planning meeting because this was, I believe, in advance of the board meeting where we said we'd like to transition this ad hoc committee to a standing healthcare industry committee. And so it was really kind of to toss around and brainstorm ideas on what to do. And so at the board meeting, what was discussed was that we would utilize, was that Director Gia would, that this committee would come together and they would discuss the challenges, many of which were discussed today, specifically having to do with infrastructure, having to do with the creation of employment, and those are the two focus areas for this committee in the healthcare profession. So what we've done, so we reached out as well to the Department of Labor, and earlier Phyllis shared with you, we are very, very supportive and interested in expanding the apprenticeable positions. Currently, there's certified nursing assistant and paramedic. We'd like to see medical assistant, medical coder, lab tech, medical technicians, phlebotomists, of course. We were discussing funding levels, and I think one of the best ways, and then kind of combining that with Dr. Hattori's discussion about the construction of the renovation of the School of Health. There's all these emerging needs where there's some federal funding and there's the need for continued local funding. And so what this group had decided to do was, as we come together to draft some ideas that could be utilized, where we could leverage GITA's community contribution fund, potentially for matching for a construction grant, or to fill in the gaps where needed. Earlier, it was mentioned that Take Care annually gives to the University of Guam and to GCC, and that's true. It's about $200,000 a year, and it does end this year. The Guam GRMC QC has also been utilized for equipment for the Guam Memorial Hospital, as well as for the Public Health Healthy Futures Fund. Last year, we piloted a community contribution grant program. And we piloted this grant program so that the grant program could be more, we wanted transparency, we wanted objectivity, and of course we wanted efficiency in doling out the money to as many organizations, agencies as possible. We piloted it last year, and we really didn't get applications from the healthcare industry, which is one of the reasons why we brought everyone together. And then we realized, we said, hey, I think the community contribution program, I think if the board takes the approach where we set aside a pot of money for the nonprofits, for the different endeavors and for the small nonprofits, and then really focus on our industries that we're trying to grow, such as healthcare, or as well as agriculture, aquaculture. Then what we can do is a board member can advocate and champion for increased funding for this specific industry, and so that's the plan going forward. The healthcare committee comes together put together projects or say, okay, you have this opportunity to supplement this project. One of the things we spoke with I spoke with Phyllis about was the CNA program. You had 2 cohorts. Is it because maybe DOLs? My thought was, a lot of times the federal entities will give you pilot funding, but they won't give you ongoing funding. So I said, I don't know how much of a budget GITA would have to provide ongoing funding, in perpetuity. But I certainly think that when times get tough, as they are right now, that I think GITA could certainly step in and help through our community contribution program to aid in situations such as this, or to act as leverage so that if we'd like to go after a US EDA grant for increasing all healthcare occupations, and there's a matching requirement, potentially we could utilize this, which I think is an even bigger impact that we could have. And I think that was about it, but I did want to acknowledge Director Faye Ovalis, who's also a member of the board of directors of the Guam Economic Development Authority. She also works very hard for GITA in her part-time.
Great. Thank you again, CEO Mendiola. Very much appreciate you pretty much tying it all together. we have government, some government support over the years for, increasing capacity of nursing on Guam, and not just nursing, but the other fields, and some that they were mentioned today too. But we want to increase the healthcare capacity. So we've seen it at scholarships at UOG, of course, other aid to UOG, through the nurse licensing board, through the programs at GIDA, through the apprenticeship programs. But I just wanted to get you all together, and I think I'm very happy. I think that you all have just really been stellar in laying it all out, in a very real way, what the challenges are, so that we can regroup and look at it all together again as to how we can improve and get to where that vision was supposed to bring us. And I think it's a good time to do it. Everybody knows the need, and there's been much effort over the years, but a lot of new passion and a lot of new energy. So I'm very happy for it. Okay, so I'm not going to talk very long because it's been long, but and I know we've only touched on a few things, and you could probably talk a lot more, and we should hear a lot more. But I'm glad that you gave us what you are doing right on this, the cutting edge on what you're doing to try to improve these programs and to grow them right now. Very much appreciate that. I'm going to now open it up for my colleagues. And I know we can't answer all your questions today, but hopefully some of them, or at least, and I'm going to start with my Vice Chair, Sabina Perez, Senator Perez.
Thank you, Madam Chair, for putting together this very important roundtable. And it's great to see a lot of the proactive and problem solving that has taken place, and just seeing all the hard work that's going towards building capacity. So Xenia, you were mentioning the total number of licensed nurses earlier. I didn't catch the total number. If you can go over those numbers again, and then.
Sure. We have 70 advanced practice registered nurses. We have 1,205 RNs, 169 licensed practical nurses, and 368 certified nursing assistants.
Okay, wow. And according to Director Mendiola, you were saying that we're definitely underserved. We have, what is the exact number you were mentioning about the ratio of what medical staff to population? This is for Melanie. If you can just remind me, what was the what was the
if you go onto the DOL site, or maybe US DOL, I can look for the specific one. But we have about the numbers as of May 2019 are about 2,000 practitioners and technical occupations, and about 1,000 healthcare support occupations. Okay. And so there's a kind of a formula, a ratio assigned to it saying, what is your, let's say between 0 and 1. 1 being you're fully staffed, 0 being there's nobody doing it. There's nobody doing anything, right? You assign that to the number that we have in Guam, and then you project out to the number that you need for the size of your population. We think we did it correctly, and we think that there's a need for about 2,000 practitioners and technical occupations, and 2,000 healthcare support occupations. US DOL does not break it down. They also don't talk about sort of those ancillary, the ancillary types. I'm not quite sure the technical term, but it doesn't talk about like massage therapists, acupuncture, like alternative medicine, but all of that is lumped into those two numbers. So it doesn't break it down. Mm-hmm.
We definitely have quite a ways to go. I mean, I think Dr. Hattori, you were mentioning that we graduated, was it 44 of nurses? It was roughly, or was it 30 nurses just this past graduating class. And And, thank you for your presentation because it shows all, not all everything, but a lot of what goes into, increasing the nursing staff. So yeah, I think for me, it's about the bottom line is how much money do we need to really kind of, in this, money, what is the exact amount of money that we need to bring in to up really kind of increase capacity. And I think also too, it's, you're looking for qualified people as well. So, we have to think about the pipeline, what's coming into the universities too. And I had an idea, but which I brought up to Department of Education, John Fernandez, and this is in regards to another project, but I think it could also work for nursing. And the idea that I have is cohorts and magnet schools in Department of Education. And if we can start young, start young at the elementary school level and really kind of increase science and math at that level, we can hopefully build that pipeline into the universities for nursing staff. But that's definitely down the road. But I know currently we can also work on the resources. And I really, wish you the best on the EDA grant. I'm really, wishing you success in that. The other question that I have too is the CARES money. So we received an interim report that only about 25% of the money has been utilized. And to what extent, to your knowledge, I think Director Mendiola, to what extent can that money be used for training or even the CARES funding that the University of Guam has received or any other opportunities? And this question go for President Kreis. Are there other grants out there that can help really build the infrastructure, and I'm talking about the human infrastructure, in training more medical providers? So maybe we could start with the CARES funding, and then President Kreis can talk about other grants on the horizon that can really address the infrastructure needs, human and both capital improvement projects.
Thank you, Senator, for the question. So I think one indication is that UOG is bringing in now $20 million in research grants. That doesn't include other kinds of contracts that we get. So the university's proven that we can do a really good job of bringing in serious money, and it's very high quality, very distinguished money. And that money's being spent here, and the economic impact study shows that we generate $400 million in economic activity. But all of that's based on the basic funding of the university. And so we're sort of, it's almost like we're running on fumes now. I mean, so the ability to bring us to this point is based on decades of fairly solid support. And in 4 years, we've plummeted 30% in our basic support. And so this means all of our, the support for things like biology and chemistry and English and math and all this kind of stuff. So we can do that. And we've actually, the applications that we have in for EDA grants, for the USDA loans, all these kinds of things. Actually, part of the problem with the USDA loan is the problem of the lack of support from the government of Guam for its only university. And so, we're teetering on the edge of a serious kind of collapse. And so you've heard this from this group that we really need to get the priorities right. We need to fund the most basic things. We need to be able to bring in money, use it completely, don't send any of it back. I mean, I would hold a hearing like this every time any part of the government has to send money back. We should be spending the money here, every penny of it, and then we should be rewarding the agencies that can bring in yet more money. Now, every penny that comes in will be specified. Well, we must do exactly what we are told to do with that. So I can't spend coral research money, $20 million in coral research money, to pay the faculty in biology, chemistry, English, math. I can't do PPE, and I can't do cleaning materials to deal with the pandemic. I can't, so a lot of it winds up in these special little pots. You have this odd situation where it looks like you're doing great things over here, and you can't fund, to keep the air conditioning going, right? So we're really, you're hearing it from different agencies and different levels of challenge, but your University of Guam has done a superb job for at least 2 decades, and I would say we're pushing 70 now, but the last 2 decades have shown tremendous improvement, and we're doing an incredible job, and the School of Nursing is a huge example of that. But we've got to figure out how to sort of maintain the foundation and then reward the activities that bring in more resources. And so I mentioned at the beginning that the travel nurse program is the most expensive nurses on the planet. And they're great, and we need them and we want them and so on, because we haven't produced our own, but we really need to stop spending the money that way, because that's really sending money away. We should be spending the money here, keeping the money here. Our graduates stay here. They're superb. They're completely committed to our community. And you see this kind of partnership that we have with all the agencies and institutions here. So if we can get the priorities straight, fund the sort of fundamental things and reward the activities that bring in more resources. We have a tremendous capacity with RCOG and ORSP and all of our faculty who do this kind of stuff. They know how to do grants. They know whether, part of it is figuring out whether it's worthwhile or not. Is this worth the effort? Because sometimes you spend a lot of effort to apply for a grant that's not worth the effort, right? So we have this sophistication way beyond, for our relatively small size, we're doing an incredible job with these grants and contracts and so on. And so we really know how, and we can advise, if somebody says, here's a $100,000 grant, is this worth our time? No, that's not worth your time. So spend your money on the ones that are generating a lot more money. So those are just a few responses to the challenges.
Thank you. So you were saying about the basically the federal monies coming in is really kind of limited by, this is one of the things I'm picking up from you, is that it's limited by the local matching perhaps, or is that what you're saying, that the amount of federal?
Whatever we apply for is really specific to whatever we ask for it. So if we get money from EDA to build an extension to the nursing facility, and say we get, I forgot what the figure is, let's say something like $3 million to do that. I can't use that $3 million to pay salaries or to pay for the air conditioning that's breaking down. I must use it to build this facility, right? Same thing with the coral reef, or the cancer grants or so. They have to be used for exactly what they're used for. And what tends to happen is we get, some sort of resource like that, and then it seems as if that's being taken away from us. Like, oh, you got $20 million. You don't need $20 million from Gov Guam. And the only reason we got the $20 million for coral reef was because of the basic investment by the government of Guam in its university. We built up this capacity to apply and succeed at this is a huge achievement to get the EPSCoR grant and all the other ones too. The geriatric grant that the School of Nursing got, that's tremendous for us on all kinds of ways, but it can't spend that money on anything except what they tell you, what you've applied for. And so we just have to recognize that the resources coming in are very specifically designated for particular uses.
Okay, great. Yeah, thank you for that. So Director Mendiola, what is your knowledge about the CARES funding? Can that be used towards building the medical capacity?
I don't really have that much involvement in the use of the CARES fund and what it is and isn't able to do. However, I do know that for the most part, it has to do with response and interruption. So everything that everyone discussed today was only magnified by the coronavirus. These are ongoing struggles, I think, that the medical community in Guam faces. And I think, echoing what Dr. Christ said, there's a real need for, there's this bread and butter support that has to be identified, that is then supplemented and specialized through grants. Because grants are usually to meet a specific need. So I'll very broadly, I'll talk about the Department of Labor. So earlier, Phyllis had mentioned this is for job placement for individuals, but the individuals have to fall within certain categories, such as they have to have a developmental disability, or they have to be a veteran, or they have to be a whatever, just a special grant. It might be a grant for native Chamorros. It might be a grant for, and I think that is something that it is, a grant cannot be utilized, and this is inclusive of the CARES Act, cannot be utilized to augment budgeted for operational expenses or ongoing operational expenses. A grant is essentially project money, and it's to address a need or a disparity that may exist, or in the case of the CARES Act, interruption caused by pandemic and emergency response to that, similar to like a typhoon or something. So I think that that's really important to understand, that as you build capacity, of course, it's important to understand what the CARES Act can and cannot cover, but I don't think that it's by any means a magic bullet in growing our healthcare support. But I think that there are, what I was going to say was, under the US EDA, one of the things we are looking at are grant opportunities. US EDA specific entities did get funding for certain things. So for example, the US Economic Development Administration may have funding for things like workforce development and infrastructure development in response to the CARES Act. So, or in response to coronavirus. And so that is something that we are looking into, but that's a little bit more, it's not, the money's not here today. It's something that we have to apply for and kind of stand with other communities and see how we stack up as far as need.
Okay, thank you for that. I think, yeah, Xenia, yes, Xenia, you wanted to respond. Thank you.
Hi, I just wanted to add that, I'm an advocate for growing our own. I've always been that way. And that's one of the reasons why I came back to Guam after obtaining my nursing degree. I always knew that because Guam is my home, I'm going to come back and give back to my people. But there's two things to look at the nursing shortage and, as we develop our nursing workforce. Number one is specialty nurses. We are so short of specialty nurses, so we need to figure out a way to get our nurses trained to start providing care for specialty cases. And that will only happen once you stabilize your foundation. UOG continues to provide us with with the registered nurses that we need, which is great. Those are your basic nurses that are eventually going to get to the point where they're going to start training for specialty. So in the meantime, I see the second prong to this is creating more CNAs, caregivers, like what Dr. Uchima has been talking about, and Faye. We need more of those types of caregivers or healthcare givers to stabilize the community. Because what's happening is you see it from way back in nursing. We used to have what's called a team functioning nursing, where you have one RN, you have an LPN, and then the care is provided by multiple CNAs. Then we moved into primary nursing because we had an overflux of nurses. We had a lot of nurses, so we went to primary nursing, and so you had nurses, registered nurses, providing all that care. Now you're seeing a reverse of team nursing again. So maybe that's something that we need to think about, is let's start providing team nursing at the hospital level so that we expand our workforce. Because you keep doing primary nursing, you're defeating, you're just, what is it called? You're overusing the workforce, and we just don't have enough at this point. But you start moving into more of a team nursing type of structure. You have the registered nurse who oversees the care. You have the LPN, and then the CNAs to provide the rest of the care. And that's safe practice too. We've done it before. Many of us, we're all in that age group. That was the nursing that we started out with. And so you also learn to team collaborate. So I think that's a great thing for nurses, because one of the things that I found out is when we moved into primary nursing, you don't see as much teamwork as when you have the team nursing. So that's just my comment.
Thank you, Xenia, for that. The other question I have was, can you talk a little bit more about the LPN? I didn't catch it. The ABN program. It's the new program that the national boards are looking at to maybe emulate. Can you just provide some information on that one?
If I could, Senator Perez, that was provided by the Guam Community College earlier, and I think they went into detail on that. So if we could maybe just go back to talk to them about that later.
Okay.
If that's
All right.
okay with you.
Yeah,
All right,
thank you.
and thank you. And so I'm gonna recognize Senator Kelly Marsh Taitanu.
Just Masi, Madam Chair, and indeed, just such a large thank you to everyone that's here for the daily work, but trying to envision how we move forward and how we build capacity to take care of our community's needs. So I greatly, greatly appreciate that. What I'd like to ask Geeta, with some of the discussion that the CEO had, is with this approach that was discussed, what is the timeline for this in your best estimate?
Specific to anything in the SEDS, and so we just put in, so currently there's 2 projects in the SEDS that have to do with healthcare. And we also put in an application to the US EDA to update for funding to update our SEDS. And so the SEDS can be populated with additional healthcare related projects, be they infrastructure or workforce development, et cetera. And so that is kind of it's an ongoing process. And the US EDA's feedback has not been quick. It's been a little, I mean, I think Dr. Kreis will agree with me. I think the app went in for the School of Nursing probably end of last year, beginning of this, like probably January of this year. So it's not a very short process. It is a long process. And then when you're dealing with construction, there's quite a bit of back and forth. You must do things like environmental assessments and sign-offs like that, and sign-offs, et cetera. You also have to come up, oftentimes you do have to advance the money for major projects. And so there's also the need to find available cash to be able to get the project off the ground. And there's also the risk of any type of matching being at risk. So again, using the School of Health as an example, if there was an emergency and they were using university funds, if they had to then divert the funds elsewhere, they'd have to identify where the matching funds would come from again. With regard to the healthcare committee within the Guam Economic Development Authority, I think that well, right now we currently have qualifying certificate grant cycle in play. So the deadline was on September 11th. And so those will be evaluated and hopefully decided on in our next board meeting. I can't say, I haven't seen the list of applicants if there were any healthcare related applications, but these were small grants, less than 10,000, having to do with, a lot of it having to do with COVID coronavirus relief. The remainder of, so on an annual basis, what we've moved towards, what we've asked, what was the goal when we came in was the bulk of community contributions belong to the community. And so what we've moved towards is, at one point in time, the decision to utilize community contributions for one project or another was largely based on politics, to be perfectly frank. And so when we created the community contribution grant program, we said, we want this to be efficient, transparent, et cetera. But the needs of a community aren't one size fits all. And in the community contribution grant program, we only had enough funding to top out at about $50,000 per project. $50,000 and probably awarding somewhere in the neighborhood of $600,000 to $700,000 in awards per year. So you're talking about 12 projects. A lot of what needs to be done in the School of in the healthcare occupations, as I mentioned earlier, is ongoing funding. And so what I think I'd like to see is, what I think is a good approach is if the GITA community contribution funds, if the healthcare committee has its a kind of a separate pot of money within the community contribution, because this is such a priority. And then that then can be approved throughout the year at the board meetings. And it can be used as a stopgap, because I don't think we can, like I mentioned earlier, I don't think we can pay for CNA classes for the next 10 years, but I think we can pay for CNA classes this year until Department of Labor picks the funds back up for next year. And so that's the biggest way that I think that that's the most effective use of being able to move forward today.
Okay, and that was very helpful. And I did want to hear that something could hopefully happen this year. So if that could happen this year, I mean, we need both short and long-term planning right now, and that would satisfy a bit of both. The other is for UOG, and I mean, certainly I know that there are different schools and there are different programs, and each runs largely independently. But because it is such a priority right now, is there ability within UOG to assist the nursing program in grant writing? Is there the ability to provide that kind of support with, because I know there are a lot of very good grant writers at UOG. Do you think, Dr. Kreis, that there's some ability to assist in that way?
So thank you, Senator. Yes, so the nursing program has already gotten a number of very significant grants. And so I'd say the nursing program itself is, you can tell, it's really maxed out. So a problem with getting certain kinds of grants is that it puts more work on your plate. And then certain kinds of grants provide some kind of administrative support, other ones don't. And so you just wind up doing the work once you get the money to do it. So these are all elements of those considerations. But I think the most important thing we can do as a community is to support the basic functions and then try to reward or to assist agencies and institutions as they can get other resources to bring to Guam, and then spend it all here, do it right, become eligible for yet more of this kind of thing, right? That's what we really need to build, a culture of that. And we've got the capacity, we've got, extraordinary people, but right now we really have to support this group of people who are doing their very best to save us from a global pandemic. So that's obviously the highest priority.
So, and I was following with what you were saying, but specifically then, is that you think that you should be able to find some people to lend out, at least in the grant writing, part of what they're doing right now?
We have a significant in ORSP and RCOG of people who really know how to do this. So so we certainly can and do and have been succeeding at doing that, right? So
okay, I wasn't sure if that was kind of university-wide or program specific, but if that's a resource that can assist with the nurses, because I know that they are spread real thin. And the last question, and it's probably a really basic one, so I apologize if it's just basic, but just to settle in my own mind, if you will. Has there been a lot of discussion, because this is such a dire time, I think especially, but to talk amongst each other to see if it makes sense, at least at this time, for maybe UOG to streamline some of its attention and focus, and GCC to streamline and take on and expand other roles. Like it seemed to me that both UOG and GCC are offering CNA programs, but GCC's program only had about 4 applicants. So is it possible for UOG and GCC to say, you know what, UOG's plate is so full, they are going to focus on the RNs and those programs, and GCC will just focus on the CNA rather than having 2 CNA programs. And I don't know if that makes sense at all, but I'm just wondering if that's been some of the discussion.
I think I'll let Margaret.
Yeah, that's a great question. And of course, for years, Dee and I have been talking about this because UOG did not want to venture into the CNA and caregiver at all. But however, there was such a demand in the community because we need hundreds, I mean, literally hundreds of CNAs and caregivers. And between the existing programs, which at the time were only GCC and GMTC, Guam High has a program, but that doesn't really produce working CNAs. Those are high school students. But with those two programs alone, they could not meet the demand. And then we applied for this geriatric workforce enhancement program grant, which brings in $750,000 a year for 5 years. And UOG only qualified because we have a CNA program. And without that CNA program, unfortunately, the requirement for the project director, no one, hardly anyone on Guam qualifies to be the PD. And so this very narrow reason enabled us. It was perfect timing. We applied in 2018, and then this grant opened up in 2019. So we need to continue our CNA because it's the only thing that allows us to get that $750,000 a year to do dementia training and other training. And I just wanted to add that we were able to get CARES money because Senator Sabino was asking. We got 90,000. I know that's not a lot, but we got 90,000 through this geriatric grant. And we've been doing, we got the grant awarded in July. And since August, we've already done 125 caregiver COVID ready online training sessions. And we're pushing out more. We've got about 800 slots. So we're pushing that out to all the healthcare providers. But, we do know, Senator Marsh, to know that one program cannot accommodate just the volume and also still do your LPN or your RN. And so, and we really were responding to a community need. But that's a great question.
Right. And
I would rather not do it.
Well, and I don't know if the grant requirements could be satisfied with an MOU or MOA. It just seems that if they only had 4 and then and you guys are stretched so thin, there might be some direction. And the same kind of, I guess, with things like University of Hawaii. I'm assuming they're built for larger classes. I looked up, it seems like they have quite a few nursing schools. Is there any ability to shift some of the online work that you're doing to some sort of partnership with them so that you can focus on fewer elements in that? I mean, do you think that there's any possibility? I'm just trying to help streamline, hopefully streamline the many, many, many responsibilities you guys have at this time.
Right. No, that's a great question. And fortunately for us, the president was supportive. One of our full-time faculty is a military dependent, and she moved off island in July. And we've been allowed to maintain her contract. And so she's doing all a theory teaching, a full-time load while she's in DC. We could explore Hawaii. The only problem with Hawaii is they have a lot of barriers in their nursing program. And UH is undergoing extreme budget cuts. They're also not accredited by the same body that we are. And about 3 years ago, they were having real difficulties with their NCLEX pass rate. It's since been much improved, but they are also struggling with their transition to online. But yes, we've been actually communicating with other schools, Villanova University, because that's where I got my PhD. They helped us in the spring and provided us some free resources and some technical assistance, particularly for Dr. Wood in our OB and pediatrics. So we are reaching out. However, I just don't know with UH with their budget situation. Their budget situation is worse than UOG's. But yes, we are trying to figure out what else we can do.
And I know UOG's been very good in the, I don't want to say in the past because it's ongoing. They have, I don't know what to call them, if they're agreements or what they are, but I know with the University of Alaska and the university, just a variety of universities throughout the US. And so, I'm hoping that at somewhere that there may be something collaborative that could take a little bit of the weight off of, your program's shoulders through those explorations. But Seduas Masi, Madam Chair, for letting me ask those. I'll go ahead and let the others ask their questions.
Thank you. I appreciate it. There's a lot of material here, and we have a lot of questions. And but thank you very much, Senator Terlaje.
Yeah. Thank you, Madam Chair. And you can always rely on me to make it short. I just wanted to say, good job, good job. And Senator Terlaje was trying to get that song on there, but I've always been an advocate for public health, especially in the nurses side. And I want to thank Melanie. And even though I, brought the idea to incorporate it in the SIDS, it was you that actually wrote that report to bring that money in. So I want to thank Gita for all the work, especially to you, Melanie, at the very beginning of my term. Knowing that I didn't know this pandemic was going to happen, but it's definitely going to help us. I want to also recognize, and all my colleagues had great questions, so I'm going to leave it from that. I've asked to see some of the reports so I can read it thoroughly and see what I can do as your senator to help you move forward in your aspirations. I just want to recognize Susan with the Guam Nursing Association Vice President, as well as Ms. Almonte, who's been sitting here throughout the hearing too as well, listening intensely, and I appreciate you guys sticking out and staying there, as well as Dr. Kevin for being here too, and all the support that you're giving everyone who spoke today. Greatly appreciate it. And feel free, please, to reach out to us as well if you have any comments that you would like to provide us as well. So thank you again so much, everyone. Thank you, Madam Chair.
Thank you very much, Senator, and for keeping it brief. I feel like there's a lot of understatement going on here. They're not bragging as much as they could be about what they've actually accomplished, and I've really tried to keen in on that myself, but just for the sake of time, I will try to do it more. But I know, for example, UOG, they're stellar in their grant writing, and they've really accomplished a lot. Many, the GNA, all of them. So I just want to thank you all for your efforts and your work. And Senator Mary Camacho Torres.
Madam Chair, I don't have any questions right now. I just want to thank everybody for the wonderful information. Clearly, there are a lot of things that I've been chasing down that will require me to maybe have separate meetings with the various of you in your programs and stuff, because many of the things you brought up were the things that, quite honestly, I was not aware were in place to the degree that they are. So I was very impressed and pleasantly surprised to some degree. But thank you very much for your contributions, and I'll certainly circle back with everybody at a more appropriate time. Thank you, Madam Chair.
Thank you, Senator. So Senator Mary Camacho Torres, she was, as mentioned earlier, we were there when they passed that the advanced practice nurse law, and she was very instrumental in that. And she's also the sponsor of the Nurse Compact Licensure Bill that will be heard on September 30. I just want you to remind you all of that. I have two brief questions, if it's okay. I want to know, so for UOG, the Gov Guam gives the money for the financial aid in kind of one big pot over to UOG, and then UOG divvies it up. What do you know what percentage goes towards the nurses program? And you said that they were giving it to seniors, hopefully to juniors soon, but is I kind of thought it was more than that. Like you tried to recruit the students earlier by offering them scholarships. I didn't realize it was only for senior year.
No, you're correct. We juniors are able to apply, and then we had been asking, we put in a request to include sophomores because we admit students in their sophomore spring semester, and we noticed when our retention dropped in interviewing them that a lot of the sophomores have to work, and going from GE to nursing school is a huge shock, but many of them can't afford to not work, and so we were losing some students because they have to work and then go to school full time. And they didn't realize nursing school would be 5 days a week. And they make comments like, well, I thought I'd only have one hard class. Well, that's every class in nursing is hard. So we have asked, but then I talked to Mark yesterday, and he said that when we had a drop in funding, and he was not able to, and I'm so sorry, I don't know if it's a drop in funding or in the amount that we were allocating. I mean, UOG was allocating. And I know he had provided the fiscal years from 2018 to 2020 to your office, and I'm not sure I can send that to you again. But he was saying that he was not able to fund the sophomores. And so that's why right now we only have the seniors graduated, in the spring. So now the ones who are seniors now are the only ones left on the scholarship. But we would like to see that expanded, because I purposely don't recruit in the high schools, because I can't promise. I mean, I can't say, oh, we've got this pot of money and you can apply. And I can't tell them that they can have it when they're sophomores, because it's never been done internally. So, I'm trying to work with Mark to do that.
All right. Oh, okay, great. I appreciate that, and I heard that the GNA president talk about their recruitment in the high schools, trying to get people interested. And I know they're always out there trying to get people interested in nursing. And so that's, very important to tie it all together. And I think the scholarships really do help at UOG. I was only there for a short while, but that was my experience. It's very important. Otherwise, they have to work. And then for Gita, so just on the community contribution funds that might be available, this is aside from, now I just want everyone to realize, this is aside from the money from Take Care, the QC, the qualifying certificate money. That's now going to GCC and UOG, and I think they split it equally, 100,000 each every year. And they've talked about what they were able to use this for, and I see that it's really important. And okay, but so for community contribution funds that may be available, how much do you think that could possibly be? What's for, let's say, the upcoming year?
The target that we're looking at for the coming year is 200,000, specific to healthcare.
And how much is it for any type, not just health?
Oh, I think we're aiming for about 600, maybe 650,000 total. So one part, the major piece of it will go out on our community contribution grant program, which healthcare is eligible to apply for as well. So everyone can apply as well. But if we're looking at very specific projects that address specific needs, such as kind of what's going on right now with coronavirus, then that's certainly something that the board will also consider separately. But I think that's why that was the primary driver behind setting up the healthcare industry committee, was that we recognized that this particular industry needs our support outside of the general qualifying certificate grant program. And so that we could push more resources this way, especially because the funding of the QC comes from GRMC, so it's healthcare.
Great, thank you so much. So I'm so glad again that Department of Labor was able to join us, and I hope that they will be able to focus some of the programs for this year, just the immediate, to immediately focus some of those towards these fields, as you have in the past, and I know as you talked about today. So I just hope that we can increase that like immediately. And and I really want to congratulate Guam Community College on their new program, and especially in conjunction with CNMI. And it's a very exciting program. So it goes from LPN, is it called APN or D? Are you still here?
Yes. So it's called the Associate of Science in Practical Nursing. So our program is practical nursing. They get an associate's, but we encourage them to continue their education. They need to pass their NCLEX PN for our program, and hopefully they can continue on to UOG, or hopefully if we can get a partnership with NMC, because we noticed that a few of our students are moving from GCC to NMC. So we felt we should reach out to them as well.
All right, I was very excited to hear about that program because according to the president, it's there is a market for it. That, for example, GRMC, they really want to recruit those graduates from that program. So it's great. And I know that we, again, I don't need to tell you all about the need. And okay, so to wrap it up, I guess I just want to thank you all. Thank you all for your work today and always, and especially during this pandemic. And thank you for caring enough to put in the volunteer time. I know most of you are doing that. It's not all a paid job for you, especially the Nurse Association. And thank you. I mean, I think we are here to help you in any way we can. And so please call on us and push us, keep pushing us, and we will do everything we can. It's the least that we can do for all that you have done for all of us. And I really do sincerely mean that. And thank you. And so thank you so much for all of your time too. We had a stellar panel. Look at all of you. You are the leaders. And I love the nurse community because you are really all leaders. I mean, the ones that I've met, they're all the leaders, and it's a fantastic community. It's a fantastic industry because it's kind of like this self-motivated already, but you put them together and they have moved mountains, and I have seen it, and especially during COVID. So thank you very much. And so my other colleagues are also saying thank you, and we're going to call this for today. It's 4:56 p.m. and the committee meeting is adjourned. Thank you again, and great job. Thank you.